unrelated chief complaints was the epigastric pain, right? The sharp sudden pain. And then you went off oxalate foods.
I'm pretty sure that's related to oxalates. I have no idea what the mechanism is.
This is the thing. This is what I'm talking about first because I think there could be some confusion there. It's most likely kidney stones.
It happens when I eat oxalate-rich foods.
Yeah.
Kidney stones.
Yeah. Have you had that ever screened? It's not a gallbladder. It's not a gallbladder.
I had ultrasounds when I went to the ER.
For your kidneys? Or for your gallbladder?
They did here.
Yeah, because everything you
but
read...
the pain is here.
It can refer there. Oh. So you know, have you heard of visceral referred pain before? It's like when you have like a heart attack, you have pain down your arm.
Oh, right, okay.
That's visceral referred pain. So what happens is like your organs have all these neurons that get to your spinal cord, but it's not a one-to-one relationship. So you have hundreds and hundreds of neurons from your organs going to like one neuron in your spinal cord, so they all converge. And if then that didn't happen, you'd have a spinal cord like this big. Okay?
Okay.
So what happens sometimes is when there's visceral input coming in, there's more input coming in from your skin and ligaments and joints and everything. So pain coming in can refer out to your skin and joints because they're all converging on the same neuron.
Oh, wow.
In the spinal cord before it gets to your brain. So that's called visceral referred pain.
Okay.
So like all the different convergence areas of the heart happen to be where input from the skin and muscles come in from the arm. And the gallbladder is like the sensory area. But the kidneys typically can be in the back, but they can go all the way up to where the gallbladder area is.
And I do have pain in the back. But we've had so much pancreatic issues in my family that...
Okay, well I'm just saying like your oxalate stone mechanism is absolutely not gallbladder.
Yeah.
And you're chasing down the gallbladder and you have like issues with your gallbladder. And
I stopped chasing it down because nothing's... Yeah.
Right, it's not gallbladder. It's most likely kidney stones.
Sweet oxalates.
Yeah.
It's right after I eat them too.
That happens when they're there. And then you can like clear some out when you urinate and drink, you know. So the key thing is like you drink a lot of water.
Mm-hmm.
And then also when you look at your history, I mean, this is just stuff, it's not your chief complaint anymore because you've dealt with it with your change of diet, with oxalate foods, but like you've not been diagnosed properly. So let's talk about that.
Yeah, I know. I don't know.
So one of the things is if you ever have an epigastric pain again, make sure you get an ultrasound of your kidneys.
Okay. Fantastic.
Okay. All right. And
I just gave up.
No, don't give up. It's clear as could be. It's almost surprising no one has diagnosed that. Okay.
Is it? I don't.
Yeah, I mean, I think the only reason is because you don't have the classical for pain right over your kidneys. But this, like someone comes in and goes, "Oh, my back is I'm really hurting." So if you have more of the presentation, like in your front by your gallbladder area, that's probably what's throwing people off.
Yeah.
But visceral distributions are different from one person to the next. They're not exact. They're like these general maps. Right? Have you ever seen that? I'll show you really quick.
Here, let's read this.
Oh yeah, please. Visceral pain patterns.
So I've used a suppository for some of my treatments, and I have pain in my ankles and my knees after I use it. It's weird.
Yeah, so these are like visceral referred pain areas, like the heart down the arm, right? Each organ has, you see the kidneys, the yellow?
Yeah.
They go all the way to the front. You know, anywhere in here.
Oh.
So when you hear like history of like, oh, oxalates, when you diet help immediately, you're like, it's kidney stones.
Oh my god.
Okay. So you have to drink a lot of water. And you have a lot of supplements. I can't remember, but calcium helps.
Yeah, I was going to ask. Calcium, which one? Calcium.
Doesn't matter which one you use. They all
and
bind
it
to
binds
oxalates.
with the oxalates.
Yeah.
Okay.
So are you taking high dose calcium?
No, not anymore.
You should be.
Okay, I will.
Because you have probably some genetic metabolic sensitivity to processing oxalates in the kidneys.
Mm-hmm.
And the more calcium you take, it'll bind to any dietary oxalates in your gut.
Yeah.
Before it gets to your kidnees.
Mm-hmm. That I did know, but I didn't realize. Yeah.
You're going to have it for the rest of your life.
Eating
You're going to have it for the rest of your life.
Yeah, for sure.
So you just wanted to avoid it.
Okay.
You might not be as oxalate food sensitive as you may think once you like start taking lots of calcium and doing things. So it makes national exposure might not be as bad. Maybe it's not worth it for you. You know. And then obviously, if you ever have those pains come in, like your best thing is to drink a ton of water.
Wow.
Okay.
Blown away.
Okay.
I guess.
And then the other thing I wanted to tell you about that is.
Like 1,000 milligrams of calcium?
Yeah, you can easily do 1,000 milligrams of calcium. The other key thing is when you went on an oxalate-free diet, you notice your joint pain going away.
I think it decreased. Yeah, it was like muscle stiffness and soreness that I'd have to like, get up and move around.
So that isn't related to oxalate. That's most likely related to lectins that are commonly found in oxalates.
Oh, okay.
Okay. Like if you look at your past food sensitivity, like peanuts, sunflower, these are lectins.
Oh.
So you're having lectin foods show up. all throughout. So many
And
people.
that is because of the lectins.
It's an autoimmune. A lot of people with autoimmunity end up with sensitivity to dietary lectins.
Yeah. Okay.
So which oxalate foods do you remember having the best impact on you?
You
Is it
mean
beans
the worst
and nuts?
pain?
Yeah.
I don't have any pain from beans and nuts usually.
But your joint pain.
Almonds make.
Almonds?
Joint pain. The joint pain. The epigastric pain was almonds.
Lectins.
Almond milk instantly, and then
Yeah.
spinach.
Well,
and
more about the
then-
joint pain, not the epigastric pain.
Yeah, I don't know if I ever made the distinction.
You never made the
between
connection.
two.
Okay. So I mean, you on the food sensitivity panel you did. You're showing like
Sweet
patterns
potatoes,
of lectins.
if I eat tons and tons of them, or like chickpeas,
Yeah.
that does not have all the.
But just
foods.
the ones would be almonds, peanuts, sunflower. Those would be the ones that most likely can trigger your immune response. Because you have two things going on. You have like an auto.
Yeah.
You did finally get a positive Hashimoto's, right?
No. Mm-mm.
Never.
No.
I thought you
no.
had. I thought you had one antibody that was positive.
I thought I did too, but it was thyroglobulin that was high.
And then when you had
Not
your
thyroglobulin antibodies.
and when you had your biopsy done, they said inconclusive, right? They never.
Yeah.
They never. You only had
They
once.
said come back and do it again.
Yeah.
And it kind of almost sounded like they damaged the sample or something. I don't
So
know.
there's a percentage of the first percentage of Hashimoto's people that never should test for antibodies. You can only find it with finding a biopsy. But if the pathology report came inconclusive,
I don't think they were looking for. Do they
they
look
would.
for
They would.
that?
They would have looked for it.
They would have.
Yeah.
That's so
And
crazy.
sometimes like they don't sample the inflamed area, they may not do as well. Or sometimes the sample itself isn't as good. Sometimes there's just not enough damage or injury to show a pattern. you
Yeah.
know. So it's possible. I mean, listen, it's the statistics are like 97 to 98% of people that have hypothyroid have Hashimoto's, and 2 to 3% don't. And the 2 to 3% don't usually had like a viral infection to destroy their thyroid.
Oh yeah.
Okay, something like that, and then they had like thyroiditis and pain and all that.
No.
It's pretty. It's like it's very likely you may have that. Okay?
Yeah.
Now, before we were here, you had the blood test draw, and one of the things we wanted to run was Cyrix-Array 5,
Mm-hmm. Yes.
and that's going to check for multiple tissue autoantibodies, anyways. So
Mhm.
it'll be another screen for antibodies.
Yes,
Okay.
I really want that.
Yeah, and remember we talked about the purpose of doing that test. Is you have to fly back, you're international, and everything. But the purpose of doing that test while we have you here is also because we're worried about some of the head trauma and injury leading into neurological autoimmunity.
Yep.
So this will be a screen for like 24 tissue antibodies,
Awesome.
and kind of see if there's any of that there. So it'll also do another screen for your thyroid, but
That's great.
you may not have it. But we want to see if you have autoimmunity, because that would be your first
Yes.
window of showing you have autoimmunity. Like if you have chronic muscle aches and pains and joints, and then diet change them like that, especially almonds,
Oh.
that's an autoimmune pattern.
Is it?
Yeah. Most people that eat almonds aren't going to have muscle and joint pain all over. They'll have like
Well, they say
with food sensitivities, you'll get like
joints.
swelling. Yeah,
But
but
it's so it's pretty quick.
yeah, it's immune response.
So interesting.
Yeah, I mean oxalate. I don't think it's the oxalate doing it. Like I said, I think it's the lectin in your almonds
Yeah.
triggering your
lectins.
immune response. Lectins
gotcha.
immediately can trigger the immune response.
Okay. Yeah,
You-
because
you-
I was thinking it would take time to distribute, and then
Yeah.
like it's happening too fast for that.
And then you have a past lab test.
Oh, okay.
You
Yeah.
have a past lab
Immune
test. Your
response.
complement proteins. Did you see that? I don't know if you look at these things.
I look at everything, but I don't know what any of it means.
Your complement proteins, they're off the chart. On your,
Wait, which ones?
complement. Yeah.
Is that's one of the recent blood
Those
tests?
are immune panels. No, this was a year ago or something.
Oh,
And
it's the black and white one. I was.
So it's like your immune system is revved up at that time.
Oh, really?
Yeah. So it's possible that those things are there. We're not sure, but it's possible. You have such a big file. We can find it later. But
Okay.
in any case, I'm just giving you some thoughts before
Yeah.
we dive into your
Okay.
history. Okay. So the key thing is make sure you start eating calcium. Take like 1,000, even 2,000 milligrams a day.
Great.
Okay. If you get pain ever again, go and get ultrasound of your kidneys,
I will.
and then drink lots of water.
Yeah.
And the connection with oxalates is probably also lectins, especially if it's nut seeds. Then it's more of a lectin issue that's triggering your immune response.
Okay.
Okay, so like it's not so just
Yeah.
kind of clarifying some of the things you're making.
Sounds
If
good.
your gallbladder's in trouble, like your gallbladder's not healthy.
Mm-hmm.
The other question I had too is when you did the ketogenic diet, could you tolerate the high fats?
Yeah.
No problem.
No problem. Never had a problem with fat.
Okay.
So
Yeah.
that was an interesting thing for me. That.
Yeah,
Never
your ejection
had.
fraction is so low. Yeah. So a lot of the stuff you also have could be brain-based. For example, you could have brain-to-gut access issues,
Mm-hmm.
right?
Yeah.
Your overactive bladder.
Yeah.
It could be what's called a neurogenic bladder.
Mm-hmm.
So the way your brain works is your brain fires into your brainstem. Your brainstem controls your digestion. Your brainstem activates pathways to your bladder that stop you from having overactive bladders. So people that get like injury to the brain or spinal cord injuries, they get what's called a neurogenic bladder, and they call it like a neurogenic detrusor overactivity syndrome, where they autonomically can't regulate very well. But that could be also neurological based too. So again, we'll have to see is once we improve your symptoms, if we can improve your brain health, if some of those symptoms change. But you have to kind of be aware of it. Okay.
Yes.
Like nothing's like, oh, that's so strange. Like everything's, wait, what's the mechanism? So you have to figure that. So you have to like be detective as we go through it. Okay.
Yes, definitely.
So you put down your main symptom is moderate to severe fatigue. Right? Let me pull up your document, which is brain based more than anything.
I just have to be on guard with what, because I get used to it, and then you forget that it's not normal.
Say lights aren't on. Set up eyeballs. Okay. So the biggest thing for me when I was reading your history, just to give you my first impression before I get deep grades, you've had serious head injury. Like your helmet broke. Like your helmet broke twice.
And I'm on the third one that I could have replaced if I were really diligent. But
how many total head injuries have you think you've had?
Well, I mean, if you count every time I've ever crashed off of anything,
you hit your head.
I don't know, like 20 pretty hard.
20 pretty hard. Okay.
I mean, like when you're learning to snowboard and you crash, lots of crashing in bikes. The bikes is only a few.
How about those that where you've maybe lost? Did you ever lose consciousness? Never.
No, once I did hit my head so hard from a bike crash that I kind of was confused walking around, like not knowing what's going on, and then I calmed down in a few minutes. But
how long did that last? 2 minutes?
A couple minutes, yeah.
The next day you're fine?
But I stood up right away and didn't lose balance or anything like that. Yeah.
But you had like confusion after the trauma. But you did.
No, then I would have been worried.
Well, you did right afterwards though, for a couple minutes, you said.
The bike?
Yeah.
I don't think so. Not that day.
Okay, but you said right afterwards you had confusion because you were walking around not sure.
Yeah, for a couple of minutes.
Oh yeah, that's what we're asking.
Oh, okay. He said the next day.
Oh, okay, yeah, okay. All right.
Oh man.
Okay, so the key thing was like, see all these head injuries, and then when you look at the questions I asked, like one of the questions was, what's ever helped you? What's made a big difference for you? What has made you worse? And like you were in, nothing helps, pretty much. Yeah. By the way, you've had the greatest hits of functional medicine. You've had Lyme's disease, you have Epstein-Barr, you have adrenal fatigue.
Yeah.
Like you've hit all the great hits.
There's nothing left.
Yeah, except brain injury. So
every bend in the road has led me here.
You've got all of them there.
So there's one thing I would just interject and say: the ketogenic diet is actually the one thing that has you have seen improvement.
Right.
Yeah, I was doing so good after 3 days of fasting. Yes. Instead of eating dinner, I said I want to keep doing this.
Exactly. Yeah. So this is what I want to talk about. So when we look at history and go, okay, this could be a mechanism, and then go, what helps, what makes it worse? And you see, like for the first time, after going through the greatest hits of everything, like you see for the first time. Or the ketogenic diet and that fasting made a huge difference in your function, right?
Yeah, and Okay. But then also all the digestive symptoms were relieved for a little bit, which was also
which could be brain gut axis and all these other things. So when you were in so a lot of people get in their fasting state and then they get into in that period, they like lose brain function because they don't adapt well, and then once you get in a ketogenic diet, I mean, everyone's focus and attention improves a little bit. For the most part, right? Unless if they're actually in ketosis.
Yeah.
And how significant was it for you, though? Like, did you feel like the lights were back on?
I would want more, but it was the best. I felt like just so alert. I didn't maybe have tons of physical energy, like strength, but I felt like a little bit of myself again. Okay.
And have you ever done that again? Have you done the ketogenic diet again?
No. At some point, my HbA1c was going down, and my nutritionist said, I'm concerned that you're causing harm, and like cortisol was high, like that my body wasn't regulating blood sugar properly. She was worried and told me to stop doing that.
Yeah, don't worry about that.
Okay. Yeah, well, I won't. Yeah, it's funny. The one thing that worked, it was somebody came in and told me not to do it.
Yeah.
Meaning.
So, like working with chronic patients, for my whole career, I can tell you, when you get a gift like that, like, oh, this made a big difference.
Yes.
Like, you can't ignore that.
It's, really
it's almost half the diagnosis is always a working diagnosis, and as people get better and worse for different interventions that have different mechanisms, that tells you what's going on.
It helps you reverse.
Yeah. So the key thing of the ketogenic diet is two things. One, ketones themselves are anti-inflammatory. They just bring down brain inflammation. Okay. So if you've had, like, I think the words that I initially thought about your case is the chronic traumatic encephalopathy, where you have head injury and ongoing inflammation.
Mm-hmm.
So people that have statements like, I functioned back again to normal or closer to normal, or it was life-changing, or it was phenomenal, you're like, okay, that's significant. Because other people are just going to say, yeah, I felt more focused, more energy, but not that significant, right? So people that have lots of inflammation will have this very noticeable difference, okay?
Okay.
Um,
Can you turn up the vibrating?
And then the other thing that the ketogenic diet can do is the ketones provide more efficient fuel. And, when people have brain injury, the biggest issue with them is they lose endurance, neurological stimulation endurance.
Yeah.
And that might be what's happening with your second complaint, which is physical fatigue and muscle weakness.
Yeah.
Okay, so I want to talk to you about that more. When you say physical fatigue and muscle weakness, is it a specific limb?
No.
It's all your limbs.
Mm-hmm.
Okay. When you start to get tired, do you ever notice tightness or heaviness in one part of your body? It's just all of it.
Yeah.
Okay.
Or what muscles I was using.
Whatever muscles you were using.
Yeah.
Okay.
I seem to be able to get through most of the workout, so I haven't done this workout since November because I thought I was maybe doing more harm than good. But maybe as I'm finishing, I start to get weak, but then after I'm really weak and lots of rage feelings after.
Okay. Really? Rage feelings right after?
Very, really strong.
From working out?
Right after I work out. Yeah, it doesn't. I mean, I have moodiness more than I think is normal in general, but it's really, really strong after I would do those workouts.
So what was the difference then when you went snowboarding? It felt a lot better.
What do you mean?
Because you wrote down in your history, you felt phenomenal, felt great. And you went on a snowboarding trip.
It's
not me.
Oh, maybe it's me.
Oh, okay. Well, then that's just me.
Okay. I don't usually get text.
But we also left a house. So we lived in this house in Japan that was new construction, and we both felt different. But I felt horrible in there. And so when we went snowboarding, we went on a trip. We were gone for a week, and I think being out of the house, out of the whatever VOCs and things in that house.
Yeah. I mean, you have
a different person.
Labs of severe immune reactivity to molds. So you definitely have some...
severe?
Yeah, pretty good antibodies, elevations.
A while ago.
Yeah. But they were checking you as IgG, which is an immunoglobulin G.
Yeah.
And that's from recent exposure. IgE is something that will measure if you now have an allergy to it.
Okay.
So some people get exposed to mold and they don't have any problems. Okay, they may make antibodies, and some people will get exposed to mold and have severe reactions. And then if the mold, they did a long-term study where they found if people were exposed to mold for many years, they start to develop an IgE response to mold. And then from that point on, they have a mold allergy, which means anytime they get into a damp building against mold, they have symptoms.
Okay.
So the difference would have been looking at an IgE test.
Okay.
So we wanted to order that on you.
Yeah. Okay.
I want to see if you actually have that. Was just an exposure, you were in the building at the time, or have you progressed into it? Because here's the thing. I'm pretty convinced you have brain inflammation.
Yeah.
Once you have brain inflammation, then there's a concept called glial priming. Do you understand that?
Yes, I watched.
You watched your thing
on
it?
Of your stuff and read your book as I could.
Okay, great. So glial priming, these microglial cells are upregulated and they turn on.
Okay.
And they stay on, and they have an exaggerated response to inflammation.
Yep.
So one of the key things, what are your triggers?
Yeah.
Because as you get your brain inflammation down, we go through different strategies, anything that triggers your immune response, those inflammatory mediators in the immune response cross the blood-brain barrier, and the glial cells get activated.
Okay.
And then wherever areas where your brain has injury is where you can have symptoms. Okay?
Yep.
Now, you filled out this form called the brain region localization form. And here, like, you have some significant problems here, meaning that you have lots of 3s and 4s in certain sections.
Yeah.
Okay, and these are different now. The symptoms associated with different regions of the brain.
Okay.
So your frontal lobe area, you had lots of 3s and 4s. I highlighted
my
them.
glasses real quick.
Yeah.
Cool.
You see all of these here?
Yes.
Like 3 to 4 means like 75 to 100% of the time. So if you have prime glial cells here, let's say you get exposed to, let's say you have mold sensitivity, let's say you eat almonds or something that triggers your immune response, it will cause symptoms wherever you have an injury. So this form helps us know, is there an injury of the brain somewhere?
Okay.
Right, because normally you wouldn't have, like, people have occasional 0 or 1, but not 3s and 4s, 75 to 100% of the time. And a set of cluster of symptoms associated with that region of the brain. You know? So this lets us know, like, your frontal lobe's not doing so well.
Okay.
And the symptoms, like typically initiating and finishing tasks, making decisions, attention span, staying focused, those are all what the frontal lobe does. So when it gets inflamed, it can't do those things. Because those neurons start to lose their synaptic integrity, the mitochondria start to not work well, so it can't make you energy. So then there's like less fuel, and then those things happen. Okay. So we have like several things you have to do in your workup. One is, with physical exam, go, is there any areas of your brain, what specific areas of your brain are injured? Then we have to like give you activities to consider to help rebuild those areas. At some point, we have to get rid of your neuroinflammation. We're going to probably put you right back into ketosis.
Okay.
Heavy ketosis.
Okay.
We'll even have you take exogenous ketones, so you're in super high levels.
Yeah.
And then we'll have you start doing some 2 to 5 day fasts. The only way you can get rid of these prime glial cells is by promoting autophagy. But autophagy doesn't turn in until 3 days.
Yeah.
I mean, animal study. We don't have human studies, but animal studies that we can interpret from. So we're going to have you do several cycles of that.
Okay. We've missed fasting in keto.
Perfect. So if you guys do it together.
I was bummed because I'm struggling with
that. It's easy when I was not working.
You told me you wanted to do it again.
No, it'll be good.
Just don't eat anything in front of her.
That makes it worse, actually. I think if you just go in, you just do it. Yeah.
So, anyways, but once you, the other thing is you kind of went the other way. You went fasting first, then to ketosis, right?
Yep.
If you go ketosis first, and your body's used to using fats, then the fast won't be as hard, right?
Yeah.
So that's the thing. And then if you take ketone salts during your fast, that'll make it way easier.
Cool.
Yeah. So did you get lightheaded or headaches or anything like that?
Not too bad. I mean, one was caffeine. So
yeah,
depending on what you recommend, you say caffeine's okay during it?
Yeah, you need it. It'll actually help accelerate everything.
That makes everything so much better because if you're not eating or drinking anything, then...
Yeah, the caffeine is actually going to make you more efficient. Because caffeine stimulates hormone-sensitive epinephrine, norepinephrine, which activates hormone-sensitive lipase, which breaks down body fat. So you're using fat for fuel and energy.
Okay.
Yeah, plus it'll suppress your appetite. Yeah. Okay, the other thing you had is you had symptoms like, see, this isn't some... I'm looking at this going, okay, Mary's got a brain trauma or neuroinflammation or something, okay? And I've worked with a lot of head injuries in my career. Like, this is what they look like. Okay.
Interesting.
So it's not like, oh, this is so surprising. This is so mysterious. It's not. Okay.
Good.
And then when you see 4s and 4s here, like reduced muscle endurance in arms and legs.
Yeah.
Does that get worse for you when you get inflamed?
I don't know.
Okay.
I mean, recently, just a few days ago, I cleaned my parents' shower and the bathtub, and I noticed that my hand that I'd been cleaning with was weak and shaky for 2 days, and I wasn't scrubbing crazy. It was just...
Yeah, you wrote that shaking going downstairs. Tell me more about that.
Shaky, just it felt like I'd done a huge workout, but I hadn't.
Yeah, it's exhaustion.
And maybe exposure to the chemical that I was cleaning with. I tried not
it's possible.
to inhale too much, but...
So like chemicals or food proteins, or like maybe even if you react to mold or whatever those sugars are, they're just gonna cause some general inflammation. And for most people, they probably won't even notice any symptoms.
Yeah.
But if you have glial priming, then it shuts down your brain, because those neuroglial cells are in an overactive state, so they can be devastating to you. Right. That's one of the main differences. That's how you identify glial priming, is an unproportional response to that are brain deficits that are causing this. Okay.
Mm-hmm.
Now you think muscle weakness, but muscle weakness isn't just muscle. Like, in order for your arm to move, it's your motor cortex firing all the way down your motor pathways to your arm. So it could technically be weakness in anything from your muscle fiber to your anterior your spinal cord, to your corticospinal tract, to your motor strip, any area that's dysfunction. Yeah.
Okay.
So like you could have maybe the chemicals promoted like oxidative stress inflammation that primed your glial cells, and now you're using your arms, but there's no endurance there.
No.
So now you're fatiguing as if you like worked out all day.
Yeah, my nutritionist said eat some rice a little bit before, maybe get some honey after your workout to blood sugar issues. And she said, did it help? It doesn't help. It does nothing really.
Right. Yeah. So it's more unlikely.
But the significance of the weakness in my arm from that was
it could be whatever you're using. Yeah. And you also said when you go downstairs sometimes. Yeah.
Well, like that was because my workout room was upstairs, and I would have to go downstairs to eat after the workout. I noticed like my legs were just like hobbling down.
So this lets us know like your motor. There's different areas of the brain. The front of the brain is like the prefrontal, and you go a little bit to the side on both sides. That's the motor strip. The motor strip controls your muscle activity.
Okay. So
So I can show you. Just Google brain regions. Yeah. So here's brain. So this is the motor strip.
Yeah.
Okay. And then the top part here controls your feet, and then your face, and then your arms, and then your arms over here. So if this is
that could be where that's a crash place.
Yeah. Well, yeah, that's what it looks like with you. The front of your brain, the frontal lobe. This is executive function, focus, attention, concentration. This area right here.
Yeah.
That is on the brain region localization form. This section here. If we go a little bit further out from the very front, go a little back in the front, that's the motor area. So when this gets injured, people will get heaviness and tightness, spasticity, and then no endurance. So it feels like you've worked out and you've maybe done nothing, done very little.
Yeah.
So that's what it looks like so far. So that's what we're seeing with your second complaint. When I was reading your second chief complaint, like physical fatigue, muscle weakness, like that's not adrenal. That's
nothing to do with
it's not the greatest hits.
Not. Yeah, no. Their theory was too much cortisol.
You definitely have a blood sugar problem. We have to get you.
Well, when we know, we can do something about it.
Yeah. So when you fill out some of the other forms, you definitely have like hypoglycemia, unstable blood sugar levels, like all that stuff.
This is like this weird combination of I'm so happy to like shed light on anything. It's nothing of it's good news, but it's so nice to start putting some.
Can the blood sugar levels, is that neurological at all?
So what happens is when let's say we assume the likely mechanism is that there's been some injury to the brain, brain injury. What happens with brain injury, when they look at studies where they look at glucose uptake with brain injury, what happens is neurons use 4 to 6 times the amount of glucose to function. So your demands for glucose go way up after brain injury because those neurons are unhealthy and they're not efficient using glucose.
Wow.
So when they do like these PET scans and look at glucose uptake, the way they actually diagnose a brain injury is where they see hypermetabolism, not low.
Okay.
Because those are where the injured neurons are trying to use up all the glucose.
Wow.
So your body could be burning up your glucose really, really quickly, especially when you're doing any cognitive or frontal lobe tasks. And then that'll make a tendency for your blood sugar to drop right away. Right? And then your blood sugar drops, then you lose your brain function, and you get stuck in this vicious cycle. Okay? Once you get into ketosis, like, it'll be fine.
Wow.
And then, and you could have some, you do have some high cortisol, adrenal issues and all that. Not to say those things aren't there, but those things are not primary.
Right.
Like, if we go after those, it's just going to waste time. And for some people, those things are primary. And that's, like, their mechanism.
That's so interesting.
So that's the hardest thing. It's like, if you get tested enough, you're going to find all these different imbalances, right? We think about any person, bring them in, we're going to test everything on you. We'll find some slight variations. But it's like, how many of those are secondary? And
yes,
primary?
That's always my question. What's the root?
And that, as in a clinical model, that's like the clinical skill. Like, like you have to know, like, what do you do, what do you not do, right? So I'm pretty sure, and so with head injuries, we see your thing, greatest hits, all these panels, all these interventions for those things with no effect. Clear history of like, yeah, I broke my helmet more than once.
Oh, man.
I've had 20 plus blows. As I was just reading it, I'm like, how could no one?
People don't know this.
The kidney stone like was shocked me right away. I'm like, come on. And then the head injury shocked me.
It's brutal.
It's like it's right there. The physical. So I think your physical energy thing. I think it's your brain.
Yeah.
So another question too is, when your arms and limbs are totally fatigued, is your brain also like cognitive function down too?
I think I feel good, and then I am exhausted later on in the day, all around.
All around.
Yeah. So that's one of the reasons I didn't mind being told not to do that for a while, was because my energy, I feel really good when I'm working out. Not as good as I'd like to feel, but mentally, like, I think you said the dopamine and all that, but then it's like the evening and the afternoon, it has to be just given up.
Right. And that's pretty normal. So meaning that if you do have like an injury, especially to the motor area and frontal cortex, if it's like really, really severe, you can't even initiate and do anything, okay? If it's less severe but still there, like when you exercise and move, you're getting blood flow to the brain, you're getting your neurotransmitters up, you're getting dopamine up. But then what happens is you exceed your neurons' metabolic endurance. You're working out more than your energy metabolism can handle.
Yeah. And
then you're cooked.
Yes.
And then the rest of the day it's over.
Yep.
Right?
Yeah. I wanted to have some more energy during the rest of the day, so
right.
That was...
So when we look at that and we look at the brain region localization form, we see like your frontal lobe isn't doing so great, okay? And your motor strip isn't doing so great just because of the way you filled it out, okay? These two areas. And then if we go to the very back, we see your cerebellum is not doing so great. Cerebellum's back of the brain. And it's possible you had like a countercoup injury where you hit the front of the brain, and then the brain hits the back of the skull, and then moves forward with your injuries. Since you, yeah, it's really common. So a lot of people that do get direct impact in the front, they injure both the frontal lobe and their cerebellum, and you have a lot of cerebellar symptoms. Okay. So the other thing is so let me ask you a few questions. So if the cerebellum is involved, so if the frontal lobe is involved, the prefrontal area, anything that requires planning, attention, concentration, you're going to have limited endurance there. So if you do a lot of those tasks, you can cook your brain and be done. Do you notice that?
Yes, I'm comparing to before. I did engineering in 3 years.
Right.
And that was difficult, but it was completely doable for me. But that kind of stuff, like I dropped out of language lessons just to work my part-time online job.
Okay.
Because I never know when I'm going to have the focus and the ability to be like kind of on, and when I don't.
Right. So there's going to be two reasons for that. One will be if there's any inflammatory triggers, it's just going to turn on your glial cells and just ruin your mitochondrial efficiency and ATP production, all that. Or even the day before, you just exhausted your brain. Your brain hasn't totally recovered. Some people recover like in 3 days, some people recover within a day. But if you exceed your brain's metabolic rate, by metabolic rate we mean how efficient your cells' mitochondria are to making energy.
Yep.
Okay. So if you exceed the amount of demand you're putting on it, not having enough fuel, it just crashes.
Yeah.
Okay. So both of those mechanisms are like going to be your thing to look out for. I'll walk you through what we need you to do when we go into tasks and all that stuff. But we're going to be teaching you how to look for metabolic neuron fatigue and looking for inflammatory triggers.
Great.
It may take us a few months to figure all that out.
I'm sure. I have figured out almost nothing, like trying everything.
Some of it is a trial and error and looking at your symptoms, but you have to have the consciousness to look for what we want you to look for. Like,
sure.
And also when you shut down, it's like, is it just your focus and attention, or are your limbs together, or do you have any balance issues? Because right now, when you look at your questionnaire form, it looks like the injuries are primarily in the frontal lobe, the motor strip, and your cerebellum. So your cerebellum is involved with balance and postural muscle tone and stability. Yeah. Okay. So do you have problems with balance and muscle tone? Do you notice?
I feel like I've always been kind of the slowest person with that stuff. Like I did climbing, mountaineering stuff, and going down.
Yeah.
I was always way slower. Going downstairs, I am way slower. Like.
Yeah. Going downstairs.
Yeah.
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 You have to hold on to the handrail.
I go near it because if I start like going too fast, it's like my feet don't know where the stairs are, and then I second guess in the middle of it. I don't know if that's what you're looking for or not, but I've always noticed that I'm slow at that stuff.
Yeah, that's called dysdiadochokinesia. It's a mechanism where your muscles can't calibrate and coordinate as well. We'll check you.
Yeah, if I try to go faster, it's not a good idea. That's why I always go slow.
Yeah.
But I can like get onto an escalator that's moving without my hands. I don't know that. I don't lose my balance there.
Yeah, because you're not just you're standing. There's a more complex motor task when you have to take steps. Okay, so those are the two areas. So we're going to do an exam, kind of see what's going on with those. And I think that, so just to, like, your chief complaint, your first two chief complaints, I think they're all related to where the injuries are.
Yeah.
Okay.
Just a question on, like, just the physical side of things. So it's a curiosity that just popped into my head. So when it comes to physical exercise, and, like, I know Mary was doing really intense workouts and, like, some of these, like, advanced movements and all of that. Yeah. But we did a bike ride in Japan for 6 months, and we were cycling every single day.
We were careful.
We were. Yeah. You did have your injury there, but it seemed like you were okay through that whole process. You had energy to get up and go on these long, 60 to 100K bike rides, and your mental state was okay. And I'm just wondering if there's a difference between, like, the cycling versus the...
Actually, what we do is with people that have most severe injuries, we put them on a stationary bike.
Okay.
Because it's just the same range of motion.
It's just the repetition.
So how much motor activity you have, right? If you're just holding on.
Yeah.
And then just pedaling.
Okay.
Wow.
That's different than doing burpees.
Yeah. Okay.
Like,
some of the stuff I was.
It's the mental.
The complexity of the motor issues.
That's crazy.
Okay.
And also, there's a lot of vestibular stimulation, like inner ear stimulation, cerebral information, just from the forward movement.
Okay.
For some people like that have like an area of the inner ear called the otolith, they'll just fall apart doing that.
Okay.
For other people, it feeds the rest of the cerebellum, and it's very therapeutic.
Okay.
And, like, maybe their anxiety or their mood completely changes when they're translating forward, like in a bike.
Oh, interesting.
And they don't have the same effect on a stationary bike because it's not moving; it's stationary.
Sure.
Right?
Sure.
But that's already, like, what I mean with trying to figure this out. Trying to figure this out is what kind of exercise you can handle.
Okay.
So maybe bike ride's it, and maybe, like, things like burpees.
Where
you have to plan and jump up and down and activate your cerebellum, and that would be way too much. Okay. Meaning, if we have you do, like, several rounds of burpees, you might be cooked for the rest of the day.
Yeah.
Right?
The stuff that she does is even crazier than that.
Yeah, I'm just saying.
Just, complicated movement-wise.
Yeah, so
that... I liked.
Yeah, okay. And I'm sure, like, you're getting your dopamine levels going up, and you feel great right away. And then
horrible.
And then horrible. So we just want to make sure you don't get to the horrible.
So I want to mention...
And by the way, every time you get in the horrible, you can't recover that day.
No.
Nope. Like, and if you're in a horrible state every single day, you will not get better.
Yeah. Because, even 3 times a week.
So if your neurons fatigue, then they can't branch out. All you're hoping for is, like, you have injured...
So that's why you don't want to do too much. Okay.
So if you have injured neurons, like, here's how this works. Neuron here, neuron here, neuron here, right?
Yeah.
One neuron flies to the other. This one's injured. This one has to branch to work.
Mm-hmm.
It's called plasticity.
Mm-hmm.
If you can't have fuel here, ATP here, this will never happen. Mm-hmm. So every time you're shut down, forget this mechanism. And then if you're always shut down, always exceeding your rate, you don't have a chance for your brain to do what it needs to do to recover.
Okay.
So you
that
can't
makes
get any
sense.
connectivity.
That's helpful.
So, like, you gotta, be very conscious of that. So you don't, search for that dopamine fix for the workout and then crash afterwards and have no...
I want to get better.
Yeah, so stationary bike or whatever. Because, by the way...
More simple. Maybe if it's weightlifting, it's just one weight in one direction.
So we don't know.
Probably not.
Your response is going to dictate the level and type of activity you do.
Okay.
So here's the thing. You want to do activity, and by the way, physical activity is an absolute must to recover. Because it turns on brain-derived neurotransmitter factor and growth factors and all the things you need to recover, okay?
Awesome.
But you're looking for it to work out that does not cause you to shut down afterwards. Okay?
Mm-hmm.
And that may be a little hard to pick out because you also have inflammatory triggers that can shut you down.
Mm-hmm.
So we got to make sure like you're not misinterpreting
Try to
the
isolate.
workout from an inflammatory trigger.
Yeah.
And you have to like go through that process of figuring that out.
Mm.
But it sounds like you've already figured out that riding a bike is okay.
That's what I remember at least.
Yeah.
But yeah.
Makes sense.
Do you have a stationary bike at home?
Nope. Whoa, we have a trainer and
That is
like
not,
a roller.
Yeah.
That could be
takes
it.
a bit of balance, but yeah, maybe it's something to think about.
You have a what?
So it's like rollers that you can put a bike on, but you have to balance on it while you're doing
No,
it.
don't do that. You get too much like this for cerebellar issues to do any kind of additional
I
balance.
did it before.
Yeah, I'm sure you did it. We
Yeah.
don't want you to cook your brain.
Okay, right. Yes. So then you can get I can get.
So you don't have
something
enough
like that.
disability so you can't do things. We're not worried about that.
Yeah.
We're worried about things that exceed your neuron metabolic rate.
Yes, that's clear.
So you have no disability of doing things. You just have not enough endurance to sustain things after.
Yeah.
So that's what
It's
we're
just
looking
enough.
for.
Like I notice my life and everything can't be the same, but from the outside, I seem fine.
So
you know?
how do you guys work out? Do you go to a gym? You work out at home? What do you guys do? Okay.
When I was doing that, yeah.
So you might need to get a stationary.
Yeah.
Yeah, that's fine.
We'll do what we need to do.
Yeah, there's no
Get
problem
a
with
stationary
that.
bike.
Out of curiosity, these types of issues as far as like long term, is this a short term situation and then things will repair, or is this kind of like it's unknown? Maybe you don't know.
Okay,
like,
so the truth is we don't know.
yeah, okay.
You may not be able to respond, or you may have some benefits, and then like it's unpredictable. Let's say it's unpredictable.
Sure.
Yeah.
But I think most people will definitely notice some benefits.
Something.
Yeah.
I've done so much with nothing. So if any amount will be great.
And also every and you're fairly, how old are you now? Fairly young.
39.
Yeah.
40 next Wednesday.
Okay, so yeah, we're catching you where you still have a lot of viability. But like every year goes by, your potential recovery goes down. And like by the time you get 50, you won't have the potential response as well. Because as we all get older, we lose, our mitochondrial efficiency, our recycling, just from age alone.
Yeah.
So that's
Okay.
why, like, if you get a 10-year-old with that injury, you can repair that. Like that, you get a 60-year-old, all of a sudden you're like, well, it's much harder.
That's
So you're 40, you still have a lot of viability.
Before I forget, the oxalate or the kidney issues that started right at the same time that I moved into a house in Seattle that was probably had really bad mold issues.
Yeah.
So
And the thing with mold is you can blame everything on it.
mm-hmm.
It could just be timing.
Yeah.
And mold is important for us because it can absolutely be a trigger for neuroinflammation. And if you have a history, like when you went snowboarding, all of a sudden you felt better, you're out of the environment, it's a big difference. Like that can't be ignored.
Mold,
Okay?
yeah, mold.
We just want to see if you have a mold sensitivity or mold allergy. If you have a mold allergy, then we know anytime you get into a damp area that you're gonna get your brain inflamed, and then you're gonna shut down, and then.
And versus
yeah.
sensitivity, which
Sensitivity means you just had exposure to it. At that time, you had an immune response.
but maybe not having any active
Yeah.
adverse effects.
Yeah,
For
at the time
exposure
you're being
now.
exposed to it, your antibodies were up, so it was triggering an immune response. So that can cause neuroinflammation. But now that since you moved in a different location, that's probably not the same thing.
It's just not as severe if you get exposed.
But if you have IgE,
That's different.
meaning allergy to mold now, then it doesn't matter where you go. If there's any mold, in the air, mold spores in the air, you're going to have it be a trigger for you. So that's one of the. So there's, like I said, there's two parts. One is like how to make sure we work your neurons and avoid overdoing your metabolic fatigue. Making sure we know how to promote autophagy, getting in ketosis state. That's all like working on the neuron and mitochondria.
Mm-hmm.
Right? And the second part of it is like we got to make sure you don't have ongoing active triggers for your prime glial cells.
Yeah.
This gets in the way. So the mold thing would be one thing that gets in the way. Okay. So then going to your second chief complaint. Like my legs begin to get shaky. I have hands coming down the stairs. That's all I think. Just you don't have the neuron endurance there.
Okay.
I don't think it's muscular. Now I'll go check you and do things, but people that sometimes have they call motor neuron disease, where their muscles are starting to have problems. They have different presentations than you. They have like fasciculations all over, or they'll start to get atrophy. I didn't read any of that in your history. And looking at you right now, I don't see any fasciculations. So it's like it could be anywhere from the nerve muscle itself all the way up. Okay. So if it's actually in the muscle itself or the nerves that are going into the spinal cord, that's called lower motor neuron. And with lower motor neuron, you get fasciculations and weakness. If it's past the spinal cord up to the brain, that's called upper motor neuron.
Okay.
and that will have a presentation similar to yours.
Okay.
Now we'll do an exam and see, like, if it's very severe. There's things called upper motor neuron signs and stuff like that.
Okay.
Have you had a brain MRI? I didn't see
No, I haven't. I was very curious about that.
So if you have enough examination findings that are off, we might need to get one.
Sure.
But that's kind of let's let the exam kind of determine that. Okay. So your hypothyroid. So now the third chief complaint: hypothyroidism. Assumed mysterious autoimmune disorder. I'm not sure. I mean, you're definitely hypothyroid, right? Your TSH was high. Because I have spotted labs. I don't have all of your labs, right? I have just the ones you said.
Well, you should have a pretty good amount of labs.
But the primary diagnosis of hypothyroidism with your initial high TSH.
Oh gosh,
that's
that
the
might
one
be
I don't have.
that I'm missing.
That's the one I really needed. Because everything from then on, you're on thyroid replacement.
I have one. 20. No, it's too early.
Well, let me put it this way: none of the other ones show high TSH, meaning you're actually hypothyroid.
Yeah, and that I don't remember honestly. Right. I don't think so.
Right.
But I do remember that being high.
Okay. So, like right now, being on thyroid hormones and T4 and T3 and having endurance issues and trying to figure all this out, we're just gonna leave that alone. Stay on your dosage, work with your doctor and all that. Just leave it where it is. Okay.
Okay.
Is it possible? I'm just out of curiosity. Is there any way that the thyroid is connected to neurological issues as well? Is there like the function
there's been some isolated case studies out there about head trauma causing those kind of disorders, but usually you see other endocrine disorders too. Okay. Because the area of the brain called the pituitary that gets injured.
Okay.
Pituitary is like so midline right in the middle. It's really hard to injure from a brain injury. Okay. Usually, what will injure that would be like an autoimmune inflammatory response, like demyelination, like MS or something that injures it. Okay. There are some important cases like endocrine disorders with severe brain injuries that like shear some of those pathways. But those people typically have like lost consciousness. They were like very severely injured. Okay. It's possible, but I don't think so. I think more than likely, you were either misdiagnosed. You never actually had hypothyroidism.
Yeah.
Or Hashimoto's hypothyroidism. But we can't tell right now since we don't have your initial. Do you know where that is? Can you find it?
I could maybe, I don't know if I could get a hold of Dr. Matano and see.
How many years ago was that?
It was 2016? End of 2016, 2017? Yeah.
Oh, I thought that was
Yeah,
before.
they did the fine needle aspiration and then said to follow up, and then finally it broke below. My T4 and T3 were low. And right now they are still low. We just adjusted my dosage down, and they were going to put it up another 5 micrograms for T3. But none of the dosage changes I've really felt any different except the last one.
Yeah, a lot of that is just experimentation, see how you respond and feel. And thyroid lab, like markers T3, T4, they're fluctuating all over the place during the day. And you're going in again, your spot test that one time, and they're like looking at the window at that one period of time, So ultimately, like can get some clues from that, but trial and error of how you feel and how you respond to it is.
Yeah, I really never responded that much.
Yeah.
Even taking double my dosage by accident, still didn't notice it.
Okay, so right now we're not doing. You're just leaving your third chief complaint alone right now. Okay.
So if they were wanting to increase 5 micrograms on T3, should I just hold off on that?
It's up to you.
Okay.
I don't think it's making any difference for you.
Okay.
But you can see, you can feel. Like ultimately, there is absolutely experimentation involved with thyroid hormones and how you respond and feel to them.
Okay. Well, if you wanted me to say the same.
Like I wouldn't say like that's it. That's going to change everything.
No.
You know what I mean? It's not a game changer. So it's up to you and whoever you're working with to experiment with that and go through it. Just keep an eye on it and let me know. So
Yeah, definitely not.
okay, parasitic infections.
Yep.
This is interesting because you said you have worms coming out of you.
Crazy. Yeah, I like.
You said you did coffee enema. You did worms.
Yeah, so
You sure?
I have pictures
You do?
I can show you. Yeah, for sure.
Yeah.
But different, like, I saw something that was not normal, and then I started paying attention, and I've been taking these worm medicines and like
Yeah, you're
antiparasitics, and I was kind of expecting like passing a bunch of stuff after I started taking that, but then really never noticed anything. And then I was so miserable with bloating and constipation at one point after eating some stuff that I started doing coffee enemas every day because it's the only thing that really helped.
Mm-hmm.
And it was after I started doing that that I'm like, hey, this is weird, you know. And then it's following the pattern. If I stop doing it, they stop coming out. And they're long. Some of them are pretty big when you pull them out and look.
So you're on, like right now, or when you wrote this,
I
you're
had
on
was
a pretty heavy anti-parasitic protocol.
Albendazole, mebendazole, and praziquantel.
Yep.
And I don't
then
know
a
why.
supplemental cocktail and stuff.
Yeah.
Yeah.
So, and now I just restarted it again, but I was telling the doctor on Monday, I did a follow-up with the parasite guy because they told me to come in earlier. And they just say continue taking the same thing for another 3 months after.
Yeah, they're trying to make sure like if there's any ova that they're treating
There's still
it.
stuff coming out though, even
Yeah.
today, yes, every day
Yeah.
that I do coffee enemas.
Yeah. I mean, it sounds like you're being managed really well there. They did the testing. They found blastocystis, the parasite.
Nobody found anything.
No,
Like
you
they
did have one.
they found like one. They didn't find worms or anything like
No,
that.
not worms.
Dr. D'Angelo.
Yeah.
They didn't find what I find, and I'm not surprised because I hear that.
It won't matter because if you have positive parasites for one and they give you the antiparasitics, it's going to have an impact on other types of. Yeah.
Okay, that's what I was not sure about. But yeah, one of them is like a couple of them have been like 3 feet long. And am I sure? I don't know what else that could be.
Yeah. Well, the point is, you that part of your management is done really well.
That's nice to hear.
I think the medications and stuff they put you on and the way they're testing you, retesting you, and then having you do another round of treatment to make
Yeah.
sure there's no overnights, like they're
Great. That's
they're on
good to
top
hear.
of it. So I would say can finish your workup with them as
Okay.
we don't want to have you change anything with that because that's
Excellent.
exactly what you should be doing. Okay.
Hallelujah. It's always tough when people disagree.
I mean, there was, I don't know if it's now's the time to ask, but there was just a couple days ago, there was a list of a bunch of supplements
I saw that.
that were added.
Oh,
So
The only one
yeah,
the only one I didn't like on that list was iodorol.
I think iodine.
Yeah.
Yeah. As soon as you said that, I was like, okay.
Are you taking it?
No.
Okay.
No, I wouldn't. I know that you said that.
yeah, we
Not-
haven't purchased any of those because I think
No,
we
we're
just
waiting to
waited.
get the opinion
I would
from
say
you.
just to work with them as they planned.
Okay.
Just do their protocols.
Okay. Minus the iodine.
They're doing an excellent job.
Okay.
What about the chelation? I guess that we can also discuss that later.
That's
if that's
different.
interrupting the flow because the blood-brain barrier.
I wouldn't do any chelation or anything now. That's the
Okay.
other greatest. It's heavy metals.
Okay.
Like you're not anywhere near for that. But don't do that.
Yeah.
Most animal studies that are done, and they can only be done on animals, because what they do is they do chelating agents, and then they dissect animals, and they see redistribution of metals with chelation into their spinal cord and brain.
Hmm.
And it's like you have to have and if your blood-brain barrier isn't healthy, and you're still dealing with a lot of neuroinflammation, we don't want to add this variable in, right? And then people that chelate go, oh, you're just having a detox reaction. No, you may not be having a detox reaction. You may be redistributing into your nervous tissue.
Okay.
So I don't think you have the health viability for that
Then
right now. And
So-
and I'm not sure if it's a big issue. Like, do you really think your levels are that bad?
I was gonna ask you because
If I had those levels, I'd be happy as possibly could
the
be.
ones in the red. Did you see the
Yeah, I saw those.
the lead and the mercury?
Yeah, and if I showed you 100 reports, you would go, mine looks really good.
Okay.
If you never see him, you're like,
I
oh
don't
my
know.
god,
Mm.
I'm like poisoned.
Yeah.
Well, Dr. Schaffner did some level of the chelating agent that was not high enough, and he redid it with 4 times higher.
Yeah.
And
Well,
the
that's
results
it.
are completely different.
If you use a pre and post chelation test for anyone? Right, like a urine sample, and then do the chelator and do it again. That's what 100% positivity rate. 100%.
So I didn't have any
So
side effects from the IV after that or anything. Like I felt fine.
That's fine.
It doesn't mean anything. It doesn't mean that I have.
It still doesn't mean it's necessarily appropriate for you.
Okay.
Listen, you gotta be careful, like when you're doing too many things at once. I know you're struggling to feel better, right? But that one you gotta be careful with. And also, your levels are not that bad. Even your like pesticide, toxic chemical ones, like you put in there. It's reading your history, like I'm too toxic to get pregnant, or like no, you're not.
Okay.
I don't know. I don't think so. Everyone has some toxic chemicals in their system. Your levels are like right on the border of normal. You know what I mean?
Like the highest one was glyphosate.
There's a couple. Yeah, everyone's gonna have those levels that are too high.
Okay. Well, that's.
You should definitely reduce your exposure to foods high in glyphosates.
Okay.
Which are mostly going to be grain
absolutely,
products.
Yeah, grain.
I mean, they're not good for you.
Exactly.
I mean, ideally, you want your toxic load to be as low as possible for a healthy pregnancy, like, as a general concept. But it's not like you look at yours and go, "That's it." That's why you feel so bad.
Yeah. Okay.
You know what I mean? So
yeah,
it's there. I mean, you need to ignore it. You always, every person should strive to reduce their toxic load.
I agree.
Right, and supporting like detox phase 1, phase 2, getting a lot of sweating. At some point, even doing chelation or things could be really a good idea, just for preventing your toxic burden in your lifespan. Because there's obviously issues with small dose toxic burdens building up and promoting like neurodegenerative disease and other things, right?
Yeah.
But right now, you being in a very acute state, I don't think you're gonna have to like figure out what's going on and do lots of things for that. Like that, you just put that on hold. So it's not that
Makes
it's
sense.
wrong. It's just maybe not the best thing to do right now. Okay.
Thank you.
Okay, infertility. So you put infertility, inability to get pregnant or have safe, healthy pregnancy based upon low hormone levels, heavy metals, parasites, and mold. You had a fertility test. You had an ovarian follicle test.
They did AMH and LH, and then she did an ultrasound and was looking at the follicles.
Did you have to put it in here?
The results? Yeah, they were in Swedish.
Oh,
so
that's why.
Maybe I had it's just a really tiny lab.
So what did they find?
The AMH was I was shocked how low it was. I don't remember the number, and the LH was also pretty low.
Well, LH being low is good. Because if it's high, that means they do FSH on the third day of your cycle?
I'm sure we timed it. I can't remember exactly. It would have been like the beginning of this year, March of this year.
But it was only only one cycle that was tested. It wasn't like
they retested it one more.
Oh, was it? Oh,
yeah,
okay. I don't remember.
It would be.
Yeah, I mean, typically FSH is more important because that's what stimulates the follicles, right? You have to have healthy follicles to have a pregnancy. Did they ever do an ultrasound of your follicles, though?
She did,
The count was low or normal?
There was 3 follicles, which is, they said it should be 10 to 12.
Right, so low.
Yeah. What did it? I think it's so small. It's
No, it's
even
not that.
smaller.
Oh, AMH levels.
That's the first one, the second one.
Yeah. Progesterone 2.5. Okay. The problem with the Swedish lab is they didn't give the ranges they use. These are different countries.
Crap!
Yeah.
And I didn't. I usually go find it and I don't.
I would if it's equivalent to the U.S., then it's low. Just want to make sure because
it was low enough for them that
different
they
country.
said they wouldn't even.
So what's the plan?
Because
here's the thing, there really is like you only have a certain window.
Yeah.
If you're letting like mold and toxicity, all these things scare you, you might lose that window.
I understand.
So.
Yeah, the plan is. I want to get as healthy as I can, as fast as I can, and see where I'm at because there's no way I can imagine having a baby right now.
Because you might miss your window by the time you get there.
I understand. Yeah.
I think the concern when we've talked is like it's just the amount, like knowing where Mary is now with her energy levels, and then the idea
It terrifies
of
me.
becoming
the thought of
pregnant,
trying
and
to
then
take care
like
of a
just
kid.
trying to
If I don't get there, I
do
don't.
that through the pregnancy, and like is that what is the effect going to be if she's already so, you know, lethargic and fatigued if you add pregnancy into
Yeah, I mean,
that
this is definitely a
factor?
decision for you as a couple.
Yeah, absolutely.
That you have to figure out what you want to do, but
Yeah.
you don't have the luxury of time,
I understand.
and you almost already may not
Yeah.
have potential for
Yeah.
pregnancy,
I get it.
and like age is the main factor, unrelated to anything else.
Yeah.
Not only for the potential for your fertility, but also
Mhm.
for complications. The number one risk factor for things like autism
Mm-hmm.
is actually age.
Yeah.
It's not toxic level
Oh,
border.
interesting.
Yeah.
Okay.
Like if you look at the published research, it's like an infection during pregnancy in combination with age. Like those are the variables that they find increased odds. It's not necessarily like you have glyphosates in your blood like everyone else does, normal pregnancies does.
Okay.
You have.
Okay. So the good news and the bad news. Yeah. We're not.
Not to say you want glyphosates in your blood and all those things, but just to say like you have a very limited window of time, and you may have already passed it. I don't know.
Yeah.
Like you're in that period.
I appreciate.
So like
frankness.
think about that as we go.
Definitely.
Okay, as you put it as your chief complaint, so I want to address it.
Thank you.
Okay. Inability to get good sleep. Next, number 6. With any reliability or any deviation from strict eating and physical requirement, nothing raises cortisol. Okay. You have a hard time falling asleep or staying asleep?
More staying asleep. It's been better recently, but there was a time last year where it was like 6 months of 3 or 4 hours of sleep, and then I'd just wake up, not go back to sleep, be wide awake, and then 5 or 6 a.m. I'd fall back asleep for a few more hours.
Okay.
But it's gotten a lot better. I got a infrared therapy light, which is strange. It seems to really
That helps
help.
you? Okay.
But I still don't know what that was due to. That was
That's probably due to your blood sugar drop.
change all. Yeah.
So
I tried to eat protein before bed. It didn't seem to help. No, nothing helped.
Maybe
It was also coinciding with starting a low histamine diet
Uh-huh.
that one practitioner recommended. And then it just kind of resolved slowly on its own. And I still don't go back to sleep easy if I wake up. But usually I fall asleep. Sometimes I don't fall asleep super quick.
Yeah. That's more still blood sugar. You may still not have enough protein before bedtime.
Mm-hmm.
But we'll see what happens when you go in
Okay.
ketosis. Because usually when you wake up in the middle of the night, it's more than likely nocturnal hypoglycemia.
Mm-hmm.
The high cortisol causes you to not be able to fall asleep.
So my cortisol, it seems to not be an issue falling asleep. Like the graph trended back into normal in the evening.
Yeah, and also
then out of normal.
But you're just slightly out the range, but your rhythm is pretty good.
Yeah.
So it's like, I don't know how much of a factor that is.
Good.
You know?
That's good.
Yeah. Okay, so let's go. So sleep. We'll see how you do with sleep. So we're going to hold off with sleep. Potentially getting you in ketosis and working on your brain endurance can have an impact.
I slept really well during some of the fasts that we did, and it was following one of these insomnia incidents, but the fasting, my sleep was like really, really good. It was really
I mean, that's the thing. Once you get into a fast, your ketone levels are in the 2 to 6 range. They're really high, like from 0.
Super cool.
And your neurons are like getting really, really consistent, stable energy. So we can recreate that.
Yeah. I'm looking forward to
This
it.
Okay,
Super.
and then the one was bladder, which we talked about already. How many times do you have to urinate a day?
I go a lot. It's not like, oh my gosh, if I don't go to the bathroom now, I'm gonna have incontinence. It's more like I feel uncomfortable if I wait any length of time, like 45 minutes or an hour if we're flying.
Yeah.
Well, we were on a 3-hour flight, maybe 2.5 to go from St. Louis to Salt Lake City, and you peed 3 times on that flight.
Okay.
I mean, it's
like every hour.
Every
hour.
Yeah.
To be comfortable, it's every hour for you.
Yeah.
Okay.
And sometimes I wonder if like I have a small torso and like my back getting backed up, like it just takes up too much room and there's not enough space for my bladder. So. I don't know.
No, I don't think it's like anatomic.
And then I don't go that much. It's just like the volume is not much. It's
which is more likely.
And then I like coffee, water, any alcohol at all. It's like yeah.
It'd be worse.
Yeah.
Yeah. So it's like overactive bladder.
Mm-hmm.
That's what it's like. If you look at the diagnosis criteria, it's called overactive bladder.
Mm-hmm.
So okay. Let's see what happens when you do some of the other things.
Okay.
There's like nutraceuticals, some things you can take for if it gets really bad. But we might not want you to do any of that right now because it might not even work if it's neurogenic, like coming from the brain.
Yeah.
From a brain injury.
Okay.
And we also want to clinically see if some of those things change. So let's just understand the mechanism, right?
Yes.
Okay. You had some like high SIBO markers. Can you handle carbohydrates?
I don't know. Like
it
feels like sometimes yes, sometimes no. Sometimes it's heinous. Sometimes it's I had some M&Ms the other day and that seemed to be okay. But on your birthday we got some kind of food and I was for 4 or 5 days just like out of control, bloating.
Okay.
It seems to be starches, but it changes so much. I cannot figure stuff out. Like sometimes then I think, it's protein. It's this.
So if you get the bloating response like you're having, it's going to trigger glial cells.
Mm-hmm.
So we got to figure out how to. You might have to be on a FODMAP version while you're in the recovery phase.
Yeah.
You've done that before.
Briefly enough, and I didn't. Like I eat cauliflower, and I thought, well, if you eat cauliflower, then it doesn't cause bloating, then it's not SIBO, Like I'd probably abandon
that's
it.
way too general. Yeah.
Okay.
No, it could be specific. Some foods you may, because what happens is this: bacteria from large intestine moves to your small intestine.
Mm-hmm.
Based on the species of bacteria you already have in your large intestine, they'll be more sensitive to certain fructans or lectins, or not lectins, but carbohydrate sources and starches. Some bacterial species may be more sensitive to cauliflower, sugars and starches, versus another one.
Okay.
So it's totally different from one person to the next. It's based on your bacterial population that's there.
Okay.
So
there was enough like higher FODMAP foods and I'm like, I can eat that. So I just kind of wrote it off. Mm-hmm. But I'd be shocked if I didn't in a way because motility is bad, bloating,
Yeah.
I don't know if something else can cause bloating like that.
It's been a tough target though. Like the food is like, I feel like you've tried, there's been so many different restricted diets that you've gone through in terms of, FODMAPs, oxalates. I don't remember all the names, but there's like, it's always been like a challenge.
So let me give you the big picture, okay?
Yep.
The big picture is even unrelated to neurological exam finding, it's very clear you've had neuroinflammation and all the sorts of brain inflammation, okay? So we're going to just head down that strategy, okay?
Yeah.
If you have a brain injury that's caused some of these things, we're really in the window of like, do you even have capacity to respond? Because some people have permanent brain injury.
Yep.
Some disability in certain regions.
Yeah.
And then some people never get in a physiological state to recover, but they could recover, which I think is possible where you're in right now. Okay. So the key thing is we want to be very aggressive for the next 6 to 8 months.
Okay.
But it's not to say that this is what you do for the rest of your life.
Understand.
And like totally go, this sucks. I don't want to live like this. I don't want to do it. Okay. Especially the first 2 to 3 months is extremely diagnostic.
Okay.
Okay. So like you have to just think, yeah, I'm gonna do the FODMAP diet while I'm doing this because I don't want to risk like this constant glial priming response.
Okay.
You know what I'm saying?
Yep.
And we'll see what my capacity to respond is when I like do everything that's possible to do.
Okay.
And then go from there. And then once like you're like, okay, I'm pretty tired. I'm feeling good. I'm feeling much better. I'm pretty tired of this FODMAP nonsense. I want to try adding some things like, okay, now add it in and see how you respond. But in the beginning, if that's like getting in the way and causing glial cells, then we're trying to get you in ketosis and do all these things that concentrate your glia. It's a problem.
Okay.
Okay, and same thing with like we got to check mold and see if that's an issue. We got to
Mhm.
make sure like that's completely
Yeah.
out of the way. Okay.
Yeah, so I'm not working because I need the time to do stuff like this
Yeah.
and follow up on it and be diligent about it.
You're on a complete gluten dairy free. So the other thing is besides like mold exposure that you have in history that could be a possibility, right? And the FODMAP mechanism. Your methane levels like popped up right at the very end.
Mhm.
Whatever I think I remember. Yes, it was right at the end. It was methane or hydrogen. One of them popped up right at the very end.
I think, yeah.
But in any case, dietary proteins from an immune model, not from FODMAP. Okay, FODMAP is
Mhm.
like the sugars are triggering
Yeah.
that. But the other part is foods could also trigger it from a dietary protein mechanism,
Mhm.
like almonds for you. Anything that causes joint pain or something like
Yeah.
that. That's not from the oxalates.
Okay.
That's from the dietary protein trigger.
The immune reaction, the
Yeah.
fast one.
Okay.
Yeah.
So if there's any other foods that you have, like you did a food sensitivity panel a while ago. Let's see, when was that?
It was a long time ago. It was much better. 2019 July.
August 2022.
Oh, that was recent. Yeah, that's the most recent one. Very basic one.
Yeah. So again, you see the pattern of like bean, sunflower seed, peanut. These are all lectins showing up. But you already. So are you gluten, dairy, and soy? What do you?
I gluten, dairy, soy, almonds. I was eggs.
The only dairy that you eat, eggs. You don't eat eggs.
I was eating butter. I have been eating butter.
Okay.
And then recently I had some gluten after I saw that, like a few of my mom's chicken strips.
What happened?
I don't think anything.
Okay.
So, yeah, I don't think anything. And like I had a few of her egg noodles just to see, because I was surprised by that. I don't know. I think my symptoms, they're not so immediate or like obvious.
Yeah, they can be delayed.
That's the trouble. So
Oh, for
I was gonna
sensitivity,
ask
yeah, you could have a delayed response.
because gluten did show up high on my one from a while back.
Yeah.
But, I mean, so between trace amounts, I've had like soy sauce and all of that
Right.
stuff. So that's kind of what my question is with our work is going from trace amounts out is another level. Like I don't have pasta, I don't have sandwiches, and I don't have stuff like that.
So, what I'd like to do is just put you on. You're almost there.
Yeah, all the hard
It's
work
basically
done.
you're basically on autoimmune paleo diet already.
Yeah.
So we want to keep you there.
Okay.
So no lectins, this is nut seeds,
Lectin. Okay.
beans, right? Which you already they're on your oxalate list anyways.
Well, if you cook the lectins in a pressure cooker,
Yeah, you get that. You get less active.
but still too much, because that really helps with bowel movements.
For you?
I with the coffee enemas, and I had like trouble going at all, but then one of the doctors I saw said beans and
They don't get rid of all the lectins.
Legumes.
The studies show they reduce the
Yeah.
amount of lectins.
okay,
There's not 100% removal.
it helps. It seemed to help a lot with going to the bathroom, but
Yeah, we can find other fiber sources.
okay.
Potentially like.
Like I was like, oh, this is one of the missing pieces. You know, it helps so much. But then I thought that's what we're gonna have to work with if we're doing keto. Then I can't. I gotta find another solution.
Yeah, you're not going to be able to eat those in keto anyways.
Right.
Yeah. Okay, let's hold that. Just
We'll figure it out.
if you got to follow this, we got to plan it today.
I'll follow it.
We're
Okay, yeah.
making the strategy today. Okay, so not down the road. So let's figure this out right now. So, what other source of lectins do you have besides the beans?
I had been eating some pumpkin seeds and like I don't do this a lot, but the energy bar that I eat when I'm traveling
Yeah,
has cashews in it. Oh, that's probably it's lectins,
Yeah.
I'm sure.
yeah. Don't do that right now.
Okay. I mean, when I had cavitation surgery, he said don't eat lectins for a month, and so I kind of got used to that.
Perfect.
Yeah, I can.
So
I
you
can
have
do it.
experience, yeah.
I can do it.
Yeah. So basically, we want you to limit your starches and fibers. Okay. And you're basically going to be eating high animal fat products, avocado,
Yeah.
olive oil, right? Those types of foods.
Those are good. Yeah.
And if you can eat those throughout the day, that'll keep you in ketosis. Okay, so they're gonna follow the ketogenic diet within the restrictions of like you're not gonna be able to use nut butters.
Yeah.
For fat protein source.
Yeah. There's a lot of things that.
Yeah. And then you're not gonna be able to use like dairy milk for it. Butter's okay.
What about is coconut milk?
Yeah, you can use coconut.
Okay.
You can use coconut cheeses.
I haven't been on dairy, but butter.
Yeah, butter's fine.
Butter's okay.
Because butter doesn't have
from the last
the
results,
casein. Butter doesn't have casein.
because I am like pretty strict off the milk and stuff, but some of the cheese came up, I guess.
It's cow's milk though.
Yeah.
You can do coconut milk cheese.
Okay.
So you're gonna do
But I
like
mean, like the butter, I was wondering why it's still showing up. If I've been,
butter. Where?
Well, no, what is it? The dairy part. I was surprised anything's yellow.
Oh, because there's a dairy part. They tested casein, cheddar cheese, goat's milk.
I don't eat cheese.
Might be in
Super
things you
sensitive.
eat. You don't know. There could be traces of milk, casein protein in foods you eat.
Well, that's what I was wondering about the butter. If there's
So
trace
there shouldn't be casein in butter.
Okay, so butter should be okay.
Yeah.
Okay.
Unless you notice any symptoms, because we're already
I
limited.
don't, yeah.
I don't want to do too much. If you can have like
Yeah.
butter
Okay.
with whatever to increase your fat intake, olive oil,
Or
avocado
eggs.
oil,
Okay.
eggs.
I know maybe
technically-
you react to eggs.
I don't know.
Sure.
I don't know.
Technically,
I just cut them out.
They're
They were high before.
they're not an autoimmune paleo. They're
Oh.
restricted.
Oh,
autoimmune
really?
paleo,
Okay.
yeah.
Okay.
Egg protein is albumin. It's very common sugar.
Oh,
Okay.
that showed up as yellow.
Yeah.
I think it's
So
like on the dairy
Yeah.
somehow. Did you say? Oh, it's lacto.
yeah. So you have
It's not
lactalbumin is albumin. It's very similar. Like you're more likely sensitive.
Yeah.
Okay.
Egg white, egg yolk showed up as green.
Okay. So so what you're gonna do is you're gonna basically follow the guidelines. Let's talk about dietary. So you need some paper.
Sure. That'd be helpful. Thanks.
I'll send you a summary report. It takes me like a couple days to get it done because it's pretty comprehensive.
Yeah.
For me, it's like all your history, your medical notes, all that stuff. It's for
Yeah.
it's for me.
Thank you for putting
but
it into words.
I'll send it to you for your medical
Yeah.
files. But the very last page will be like, this is our plan,
Great.
and then it'll be everything we're talking about is going to be summarized. But let's get you started before. Okay. So basically, do you have a ketone meter?
Yes.
You get
But
a
we're gonna have to replace it.
Yeah.
You need to get a ketone meter.
Yeah.
Make sure you have ketone strips. We got to confirm you're good in ketosis when we measure ketone levels.
Okay.
Okay. You're gonna need to get some exogenous ketones. Right, you can get those online anywhere.
Just
Beta hydroxybutyrate salts. You guys are in Sweden. Is there Amazon Sweden? Is there something?
There is. Yeah.
Oh, it's useless.
It's useless.
It's not
Beta
that great. Yeah, that's true.
hydroxy. Beta hydroxy what?
Butyrate.
Butyrate.
Yeah, just exogenous sea salts. Amazon SE.
That's it. That's right.
That's what I do with all my international patients. I work.
iHerb is good for international patients.
What's that?
iHerb?
iHerb? Okay. See if they have
Man, they like a grade less. They don't have like.
You could also take
silver,
MCT oil. I just know
which I have tons of.
So you can
The
use MCT oil.
C8.
So MCT oil gets converted to ketones. Okay.
Okay,
But
MCT.
I also want you not to totally stress out your gallbladder, and actually immediately get your ketones up.
You
okay.
don't want me to get them up? You do.
Yeah. I don't want you to just use high fats. So I want to take some of the stress off. Yeah, exogenous ketones.
If I never had any pains or things with the fat.
Oh yeah, there you go. This will work. Any of these will work.
Take a picture.
Yeah. I'll send it to you right now. I'll
Oh,
send you the
thanks.
Let me.
Sports research. Is there like an amount?
Do experiment. We can
Okay.
experiment. So I'll explain that to you one second. Let me just get this link sent to you.
Cool.
Go ahead and type your email address. That's it?
Yeah.
Okay. So, the goal normally, like, let me put it this way: ketogenic diet is done for different reasons. Like, when people will use ketogenic diets for seizures, people use ketogenic diets for weight loss, to control diabetes. With you, we want to use it to dampen your brain inflammation and get you into autophagy. Okay, so we're not always concerned of, like, when you take. So here's the thing: when you take exogenous ketones, it's gonna your test is skewed because you just took them, so that's what it's gonna measure.
Yep.
It's not like your body's actually dietary wise in
Yep.
ketosis.
Yeah, so when we work out, then the ketones also go up, so they say don't measure right after you work out.
Okay. So what you want to do is figure out your ketogenic diet before you start taking any exogenous ketones.
Okay.
How much fat is it going to take for you to get into ketosis?
Oh,
Right?
not just cutting out the carbs.
Yeah.
Oh.
So if you don't get enough healthy fats, like 80% of your calories should be coming from fats.
80%.
Yeah.
Okay.
What's the definition of like any ketosis? Is it a certain
Above
level?
zero.
Anything above zero.
Yeah.
So if you're showing ketones, then
Yeah, we're
you're in
good.
ketosis. Okay.
But then once that happens, we're gonna add in ketones throughout the day.
Okay.
But we want to make sure, like, because sometimes if you eat way too much protein, if you eat like lean chicken all day
Yeah.
or like a lean steak with not enough fat in it, you just can't get there.
Okay.
So we have to like figure out how much, like, what kind of do you need to eat? Pork chops? Do you need to eat a ribeye?
Okay.
Do you need to add olive oil to your ribeye? Like, what is it going to take?
Oh my.
I remember. So it's tough for us because we've never gone into ketosis without doing the fast first. We just that was our
You could
way
do
of
that-
forcing
you could do-
ourselves
you could
into
do that too.
ketosis, was
You could
just,
do that too.
Yeah, a 3-day fast, and it was like, okay, you come out, and then we just stayed on it through our diet.
It was no carbs the dinner the night before. Wake up, go on a really long walk.
Yeah.
And then, yeah.
Well, within 24 hours, we were on ketosis.
Yeah,
typically,
yeah,
but
you could do that
We
too.
were fasting.
So that's another option. If you want to do it that way, if you feel comfortable doing it that way, you could do that again. What do you want to do?
Oh. I don't know.
I mean, to me, if it's not an issue doing that, we know it works, and I'd say
Do that.
because it's
Okay,
like,
so once you actually get into... So my only concern with this is when to start using exogenous ketones. Because I want to, like, when you get into ketosis, your levels are going to be, like, above zero. They might be 0.5. They might be 0.6, right? Maybe they're 1.2.
Mine got there pretty quick.
you were always higher.
But
than
not
average, yeah.
related to fasting. Let's just-
No, well, yeah, sorry, yeah, okay.
Yeah, okay. So if you go into fasting, it's going to be 2 to 6. It's going to be
It was high.
Yeah. Or even higher. Okay. So it's going to get way up there.
Without MCDs, yeah.
Yeah. So the thing is get into ketosis like you did with the fast. Boom, you're in it within a day, right? And then start eating again, okay? And then when you're eating foods, measure your ketones, but don't use any exogenous ketones yet. So
Okay.
we know what is keeping you in ketosis. Like if you're fasting, you get in ketosis, and now you have a high protein meal with not much fat in it,
Mm-hmm.
you can get out of ketosis. You're no longer in ketosis.
So, how long after you eat to measure?
Oh,
If you after
you have to do it several times a day.
for sure.
But is there a certain window after you're consuming
check the
food that you
ketones.
should check?
So you can check an hour before or after, you know,
Okay.
but
It's
it's variable. It's
Yeah.
variable. Like it depends on your body.
Okay. Yeah.
But if you're out of ketosis, it's going to happen within an hour.
okay.
After
So you yeah, what you're saying is sustained and don't get near
Yeah.
going out.
So there's like an experimentation phase because you're going to be doing this long term.
Mm-hmm.
There's an experimentation phase of like figuring out which foods, what things you do, if really raise your ketone levels.
Mm-hmm.
Because what we're going to do is we're going to add in exogenous ketones daily.
Okay.
And we want to make sure that you know how to get it into ketosis efficiently. So when we start taking exogenous ketones, you're like not blowing it. Like,
well, you want to ensure that you're maintaining a specific
Yeah.
level.
Because
you're
we
never
won't
dipping
know
out of
where
ketosis,
yeah.
and you don't want to falsify the data
Yeah,
when you're
exactly.
actually reading your result.
Yes.
You want to,
Yes.
It's just maintaining. I would say.
And you can
I
take
mean-
MCT. By the way, you can take MCT oil. MCT oil is not exogenous ketones.
Okay.
It immediately converts to exogenous ketones. So that might be like another strategy you do. Like I can't get enough with the meals. I have to take 2 tablespoons or 2 capsules of MCT with each meal to make sure I get into ketosis.
Okay.
So we want to like see what is your potential. Okay.
Mm-hmm.
And then once you figure that out, it might take you a week to really figure out what's working best for you. Once you figure that out, like keep a journal of that, and then like know your strategy, and then we're gonna add in ketones. So then, like, like the exogenous ketones list we have, like whatever one you pick
Mm-hmm.
from whatever source, like you said iHerb, if that works for you, that's great. So let's say you did this first one, keto BHB. It's mixed berry lemonade. You can like take a scoop of that. That's going to provide a lot of ketones. These are no joke. 65 milligrams of pure butyrate ketones. That's a lot.
And so you said the MCT is also okay or not okay?
Yeah, it's okay. It won't. It just this will be right away. No stress on the gallbladder. You get these levels high.
Oh, got it. Okay.
And then let's see how high can we maintain it. What's the highest like super ketosis we can maintain for a while? Because our goal is dampening brain inflammation. Like some people like if it was weight loss, you're like don't do the ketones at all.
Mm-hmm.
Because we just want to use your body fat for energy. But that's not you.
Right,
We're like,
right.
we want your ketones
Right.
really high, as if you were in a 30-day fast or something, to just bring that inflammation down and get that flow to the mitochondria, put you in environment for neuroplasticity.
Okay.
So that's the thing. Does that make sense?
Yeah.
This
Okay.
is energy, basically.
Yeah.
When you put this in your body, it's
Mhm.
direct.
It's direct.
Yeah, okay.
Direct fuel.
And the difference is that this doesn't have to be processed, I guess,
And,
by your body.
and this may do a couple things. Bring down brain inflammation. Also may immediately change your brain endurance. Because a lot of your symptoms are probably happening when you crash.
Mm-hmm. I'm sure.
So we want to get your mitochondria as efficient as possible. Okay?
Mm-hmm.
And if you get your mitochondria as efficient as possible, like one part of brain recovery is something called mitophagy, where you get rid of unhealthy mitochondria.
Yeah.
That happens when you sleep.
Mm-hmm.
For long, like good circadian rhythms for periods of time is when that happens.
Mm.
So hopefully getting deep restful sleep.
Yeah.
Your blood sugar is no longer going up and down, right?
Yeah.
So that's going to stop a lot of the neuroinflammatory issues, and you're completely stable. And then what you're going to have to do is, let's say you take a scoop of this.
Mm-hmm.
So let's say your dietary ketogenic model gets you into like somewhere between 0.5 to 1,
Yeah.
just by diet. Okay. And that's okay. That's good. But let's say we're shooting for 2 or 3 or something. You take a scoopful of some exogenous ketones, and now you're at 2. Okay. Next question is, how long does that last?
Mm.
Does that last for the next 4 hours? Does that last for 2 hours? And then and then the next 4 hours, boom, another scoop.
Okay.
And then keep those levels high. And then before bedtime, for sure before bedtime, take a scoop.
So this will be the trial that you're going through for a period of time to figure out. So you might be testing your
Yeah.
ketones every hour.
That's
Just-
exactly it.
Oh, my fingers.
So we want to see what can we do? Like everyone's different. Not everyone. Like some people take a bunch of ketones and levels only bump up so much. Other people it stays. And how long it stays can vary. Like also with your activity level.
Ah.
And if you take it and then go work out or do something,
Oh, yeah. That's
they
another
can be
question.
depleted. But you just want to get a general idea of how high you can keep it sustained.
So
Like that's our initial treatment plan.
Mm-hmm.
So you're gonna fast into ketosis. Measure your ketones. Okay, make sure you're definitely there, and then go into ketogenic diet. You can use MCT, but you can't use ketones. Once you establish your ketone range within ketogenic diet
Mhm.
and optimize that, then we'll add in exogenous ketones. Okay, once you add in the exogenous ketones, then we're going to see how long they last, and what's your window of time, and how many times a day do you need to take some exogenous ketones.
And to stay at what level again?
Let's just shoot for about 2.
About 2.
2 to 3 week rate, because that's
I
like
feel like that was no problem. fasting.
When you're fasting, yes.
Not fasting, sorry. We did the ketosis after.
Yeah, after day fasted, they can go up really.
It'll be interesting to see. I remember. I mean, we've got some good resources.
So map it out and put on a sheet, and kind of look at these things so we can. So just so you guys know, like what we'll plan on doing is we're gonna talk once a month after today, and then get on track, and then I'm gonna have you send me emails once a week with some questions. We're not done with all the questions yet, but I'll give you a list before we leave, and then actually we can figure out right now. We'll go over the questions, and then every week when you put them in, it's just like in our Dropbox. And then what Susan does is, before we do a consult, she pulls all those out, puts it in a file, and then when we get in a consult, we can go through and talk and figure out what's happening.
Okay.
So it's used as a way to kind of just journal everything, and then when it's sent to us like each week, we just keep track of it. But I'm not going to respond to your email. It's just like, hey, unless you have a question, then put question different than.
Yeah.
Okay. And then we'll keep track of those things. So the questions I'm going to ask you while this is happening, okay? So write these down. These are going to be things you're going to email me every week.
Okay.
Your ketone measurements, your ketone levels with diet and exogenous ketones.
1 second. Weekly email.
With your diet. That's going to be initially, and then with using exogenous ketones.
Okay.
So we want to know your symptoms of your ability. First of all, your overall brain endurance. Brain endurance, brain function. Right? What you're calling like being lights off.
Mm-hmm.
Anything you tell me related to that.
Okay.
I want to know about your arm muscle fatigue. Okay?
Any muscle or just one?
Yeah, like the things you complain about. Like your
Right.
chief complaint number 2.
Okay.
General muscle fatigue.
Yeah.
Is that what?
Yeah. Let's hear. Physical fatigue, muscle weakness.
Mm-hmm. Okay.
Any real exertion results in extreme muscle weakness.
Yeah.
That stuff.
So then, would you want me trying to do some kind of workout or?
Yeah. Right now we want. Remember. So we'll get to that.
Yeah.
But, okay. Because remember, stationary bike.
Oh yeah.
Okay. So you're gonna brain function, brain endurance, arm muscle fatigue, and the other thing I want before you do that is I also need to know about your sleep. Your sleep quality, you're falling asleep, staying asleep, any of that stuff. Okay. If those things don't change, we're not gonna get anywhere.
Mm-hmm. Do you just general comments or with ordering data? I found is pretty helpful.
Yeah, whatever
Okay.
whatever you want to track, you can send. That's great. Okay.
Okay.
Okay, so that's the dietary part. Does the diet part make sense?
Mm-hmm.
And then the ketone meter, and then tracking levels, right? It's all the initial step. So the next step is then going to be the stimulation. So let's start with the stationary bike. The rule is you can't crash afterwards.
Oh, okay.
So you have to figure out 2 things: your intensity and your duration. So intensity can make you crash, and duration can make you crash. So figure out what your intensity and duration is.
Yeah.
The more intense you make it, the more therapeutic it is, but the more likely you'll crash.
So is the objective to get up to the point where it doesn't make you crash, essentially? Yeah. So you are just kind of okay.
Yeah. So the duration isn't as impactful, to be honest.
Yeah.
It's intensity. Because intensity is what then turns on release of like brain-derived growth factor, growth hormone, all the things you need to have neurons connect and heal. Like if you just do really low intensity for an hour, that may not be the same impact as a higher intensity for a few minutes.
So the balance is super important. That's how we did our long bike rides, was
Super.
low intensity. You know.
Yeah. So
That's how we
you might
survive.
only be able to handle low intensity. Don't jump into high intensity, okay? Because even low intensity is still therapeutic. It's just going to be more therapeutic if you have intensity high.
And the measurement of intensity is just your heart rate?
Yeah, you need
Essentially,
your heart
that's
rate.
the easiest way.
Yeah.
My heart rate gets up high easy.
Good. Okay.
So
So you might even do like a bike ride and then do like, let's say you do 10 minute, start with like something. Don't go crazy, okay? Start with something like 10
Yeah.
minutes, and maybe at a 5-minute mark, you do a 10-second, 15-second high pedal,
Mm-hmm.
and then at the end you do that, and then you kind of recover and rest, and see if that made you crash. So even if it's a burst every 5 minutes, or maybe eventually every minute, just some intensity. Like we don't want you to do 10 minutes of high intensity bike riding.
Okay.
But we want, if you can get a little burst in without crashing, and maybe the burst is only 5 seconds. That's every minute. Like, have fun, experiment, see what works best for you.
I wanted to do HIIT anyway. Okay. Then I'll always be tired, but I mean, what do you define as?
I look for the shakiness.
Oh, okay.
Look for that where you lose your motor function, your shakiness. That's what we want.
Because I did a while back, like half marathon, and I would just like pass out asleep. I don't nap, and I would just sleep for the afternoon. But I don't think I had muscle shakiness.
Yeah, well, let's see the muscle shaking. Well, let's see what your symptoms are.
Okay.
I wanna see what you can tolerate.
I'll make notes whether or not I.
Yeah.
Okay. Ooh.
Okay.
Yeah.
So you get diet, you got stimulation. We're going to do a full detailed neuro exam, and then from there, if we find any specific regions that are involved, I might give you some specific brain exercises
Mm-hmm.
to activate those regions. But that's after the exam.
Okay.
But as far as like where we're starting is this, okay, and then what we're waiting for is to get the Cyrix
Yeah.
antibody test. How long are you guys here for?
Town?
In the country, yeah.
Oh, in the country, yeah.
We're in California Saturday, and then my current plane ticket back is November 3rd.
Okay.
But
So we're going to send you out. I want to get updated blood tests, and I want to measure those mold antibodies.
okay, great. Just let us know what you need.
Yeah, so you're going to go to a local, like we use LabCorp, they're all over the country.
Yep.
So whether you're in Northern California or here, you can go to them.
Perfect.
And then,
Okay.
We can run in there tomorrow because we're still in town until Saturday.
Yeah.
So
so there's some markers I run with neuroinflammation, like I measure something called S100B, which is blood-brain barrier permeability, and also marker for inflammation, check mold antibodies.
Okay.
You need to check your complement proteins again because they were so high, see if that's still up.
Okay. I have an appointment tomorrow at the laboratory wellness, and it was in case I needed to get the Cyrix done here, but maybe they also can
It's a
do
different
this.
lab. It's a different lab.
Okay, so it does need to be
Yeah.
Cyrix. Okay.
No, it's a
Do
different
that.
lab. This will be LabCorp. Complement, OptiCaplex, mold, antibodies. I'll send you a requisition form tonight.
Okay.
I'll write it out. There are all the things we need. It may be like $300 or $400, just because we.
Thank you for letting me. Yeah. That's
Yeah.
helpful.
Okay.
I appreciate your diligence with the cost. That's nice.
Yeah, I mean, but we need that right away.
Yeah.
Your big expense with labs will be in the beginning seeking. You're not going to need to do this all this time. For the most part, once we figure this part out, we should be good.
Well, if we need the labs, we'll get them. That's
Yeah,
not what
I'm not trying to make things less expensive for you. I'm just trying to figure out what we need to get done, but let you know, like, hey, like, figure this out. This is what you need right now.
Can I fasting and coffee before, or is that a fasted?
You can drink coffee before for the blood
Okay.
test.
Okay.
It's a water, just drink water.
Coffee,
But
water.
we're
no
doing a
food.
fasting blood glucose on you.
And coffee's okay before that?
Mhm.
Okay.
You're good. I mean, not immediately right before the test, but in the morning if you want some.
Okay.
Yeah.
But no food for that. Yeah, fasting.
Okay. You have any questions for me?
How long before the lab coffee? If there needs to be a separation.
When you wake up, just have some coffee and then just drink water the rest of the time.
Okay. Got it.
Do the best you can.
Did you have a few other questions?
I have a lot of questions, and I think I mentioned it to John, but
Let's go through it right now.
Oh, okay.
How soon do you want to start fasting?
I was going. I want to figure that out with traveling back to Sweden and
Okay.
because our travel.
It's
plans
so.
affect-
Here's the thing. It's totally up to when you want to do it.
It's easiest when I'm at home.
Yeah, I'm just saying.
Yeah.
So, but the first thing is like, so you can initially fast to get into it for a day or so.
Yeah.
Right. Then get into ketosis,
Mhm.
and then once you have like figured out your ketogenic dietary issues and start taking ketones, the next thing is, I'm ready to do an extended fast.
Mhm.
Okay.
Okay.
And maybe it's too, for some people, like, you have to see how you feel. You may have a difficult time just jumping into a 3 day or plus fast. Maybe 2 days works for you in the beginning, and that's what you start with. And then you take a break, and the next time you do a 3 day.
My experience has been the beginning is the hardest. And
Yeah.
once you're through the beginning,
Exactly.
which is any amount, then good.
Good. Okay. So if you feel good in 3, go to 4. If you feel good at 4, go to 5.
Yeah.
So we did the last fast you did 5.
Yeah.
So
And
fi- so
I'm
5 would be
expecting it to be.
I wouldn't go past 5.
Okay.
The more we did it,
I'd rather have you take a
easier it
break
got.
and then start again.
I
Unless-
have a copy of this if you want it.
Let
It's
me
kind of-
take it back. You can go up to 7, but you might start losing muscle mass.
Mhm.
So that's the only one thing. We don't want you to lose too much muscle mass.
Okay.
That's why we kind of break it off at 5. But if you still feel good, you can go longer. If you can get any kind of movement in while you're fasting,
Yeah.
that will slow down your muscle
Okay.
wasting.
Movement, but not.
But you're not going to lose any in the first 3 days or anything like that.
Yeah,
Maybe you
okay.
might even lose any. You might not even lose any by day 5. But just see how you are. If you
Mhm.
feel really frail and really weak and all that, and
Mhm. I
take a
remember
break.
being surprised how normal I felt.
okay,
So-
now you can take exogenous ketones during your fast.
Can I?
Yes, can.
Can. Okay.
Yes, you can drink coffee and take exogenous ketones.
That's huge.
That will get rid of all your symptoms. Usually, when people get lightheaded and feel frail and can't think and focus, as soon as they take ketones, they're back up.
Mm.
And because remember, the ketones are salts. They're ketone salts.
Okay.
So you might, if you're going to go 3 to 5 days, get some trace minerals.
Okay. I had some to add it.
Take some trace minerals. Make sure you get lots of salt.
Okay.
Just even drink some sea salt with water.
Yeah, we did that actually. That was one thing we would always be really diligent about.
Electrolytes are going to be a problem. Calcium. So during your fast, it's going to be calcium. Let's say it's 1,000 milligrams. Okay, which is not much. Potassium. Let's say it's 1,000 milligrams. And then trace minerals. Salt water. And exogenous ketones. Okay.
We did not use the salt in the end. We stopped.
If you add any protein, it stops autophagy. So even bone broth.
I didn't have anything.
Bone broth will probably still keep you in ketosis, but it'll
The
stop
autophagy.
autophagy. And we're trying to get to autophagy.
Yeah. Okay.
Okay.
Yeah, no protein.
So this is how often you redo it, how many times you want to do it. Once you get into ketosis, figure out it's totally up to you. Okay. But you're going to do several rounds in the next few
Okay.
months.
Of fasting.
Mm-hmm.
So that's the other thing. The parasitic medicines, they say to take it with food, but I wonder if that could be with
No, you're gonna totally need to do that with food.
Yeah,
Okay,
that's
you're gonna have to work around that.
So you have the 1
It's
week
3 weeks on, 1 week off.
and it's once a month. You have a break. So
Oh, okay, fasting in
the 1 week off.
that was with the gallbladder cleanse during the week off. So it's the phosphoric acid.
Can you make it work?
Well, I think if you do your 3 weeks on your medicine, which is fine, and then if it sounds like
We
we
just
were
started again today for 3 weeks.
yeah, and then I think in 3 weeks time, when
Fast.
you're off, we just do it fast.
Yeah.
I think that's probably
Okay.
That's what-
and
Yeah,
then I think it's 3 to 5 days.
you won't be able. You're gonna be not functioning with those antiparasitic medications and no food.
Yeah.
That's way too much. You throw up or something.
I
You
got
for sure get nauseous or.
yeah, that did happen once. It went way quick though.
Okay.
Okay.
And so once a month is okay.
Yeah,
Fasting.
that'd be great.
Yeah, we did that. I mean, we were doing basically 3 days.
I'm looking
Every
so
third
forward to
month
that
was
again. Yeah. Okay.
So
Okay, and then so you're gonna figure out your workout routine. You're gonna do this is the fasting routine.
The workout, does that go during fasting as well?
If you can.
Okay. And then how many
And the
times-
workouts that'd be beneficial to you would be more strength, like push-up, squats, things that keep your muscle tone, not necessarily
during the fast.
endurance. Yeah, during the fast. If you're gonna work out, make sure it's muscular activity development, strength training.
Yeah.
And if you're frail, it might just be some push-ups, some air squats, some tricep push-ups or whatever, not like on the bike.
Body weight.
As a matter of fact, you probably want to limit your aerobic and just do strength so you can maintain muscle. Okay?
Okay.
Right, you're taking a lot of supplements. But, I don't care about any of the supplements you're taking right now. And if they're part of your GI protocol, just continue with them. Don't get off the Adderall.
What about the NEC? No, yeah.
It doesn't matter.
Okay.
None of these things will make any significant difference what we're trying to do.
I feel that. Yeah. So then what's probably going to happen is I would have just dropped them off.
Okay. It's up to you. I mean, definitely stay on your parasitic protocol.
Got it.
But
and the stuff that
right now, like, we don't care right now.
Okay.
Now, if you get your blood test back and like we see like severe vitamin D deficiency or something like that, that's an issue. Okay. And also there are flavonoids and things that can dampen neuroinflammation, but we don't want to do any of those right now. You can go deeper with the neuroinflammation pathway if we need to, but we just want to see how diet alone impacts function and symptoms.
Yeah.
Right.
Okay.
Yeah.
So
we may add nutraceuticals down the road later to be more aggressive. We just don't want to do it right now because we want to see the response, how you function, or maybe you don't function. Maybe we'll have to like really use a ton of neuroinflammatory compounds to get your system to kick in, or
Okay.
You may have to use other fuel sources than butyrate to get your mitochondria to work. We don't know yet.
Yeah. Okay.
But this should work by itself. Okay. Well, we always want to limit supplements as much as possible.
Yeah.
And just have your physiology change.
Yeah. That's great.
Okay. What are your questions?
Oh, okay. So I have a copy of this stuff. It's more just so that I can scan through it, but it's written kind of for me. If you want a copy,
you can just read it to me.
Okay. So the mineral analysis it's Dr. Yu, the parasites guy.
Yeah, you don't have to mention.
Okay.
Names.
Sorry. Oh yeah, that's right. Okay, so I'm just scanning through because we covered some of this. I have the genomic analysis SNPs, but I heard on one of your podcasts that maybe you don't focus so much on that. So I have the file if you ever need to see or want to see anything.
I mean, it's different than what you sent me.
I didn't send you the complete, I think it's 200,000 SNPs that Dr. Miller does. So I just want to mention that
I wouldn't even know what to interpret 200 SNPs for.
Okay. And then I mentioned the worms. So I've been looking to see what's coming out more diligently, but recently there was a ball of hard sandy, it was really weird, in my stool. And it broke apart like it's totally dry inside.
Yeah, I'm sure it is.
But
you're doing what you're doing. Your parasitic issue is being handled the right way.
Okay. Yeah, I was gonna ask about T3 conversion. If there's anything that you see, that's maybe not what we're focusing on at all, though. Because I saw something about DIO2 and the way I haven't responded to thyroid meds and all that.
I didn't see anything to really scream out on your lab test.
For T3 conversion?
Yeah. I can add reverse T3 if you want. Your blood test.
It was down lower. It's been high before.
See, here's the problem. T3 itself is not that good of a marker.
Oh.
It's a snapshot.
Yeah.
And free T3 is really bad.
Oh.
Because even within hours it changes.
Okay.
Free T3 is totally unstable. There's no protein attached to it. It's a free fraction hormone.
Yeah.
It's all over the place.
Okay.
If you're using free T3 to determine your T3 levels,
I don't know what they usually use.
It's not reliable.
They're I don't know.
If you have an underconversion issue, there's a marker called reverse T3 that'll be elevated, which is much more reliable and stable.
That's been up to 18 at one point, but it's down now till it was 6 or 8 or
Okay, let's measure that again. I'll add reverse T3 to your profile.
Is the results on the Dutch are reliable?
Yeah.
Okay, so all my neurotransmitters.
Oh, not the neurotransmitters.
Oh no.
The hormones, yeah.
The hormones, yes.
Yeah.
So okay.
Yeah.
Because they were so low. A lot of them were so low. Yeah.
Let's see. They were on the. You were really concerned that levels were really low.
Yeah, everything was I'm wondering if it's early menopause.
Yeah, I mean you might be there.
Yeah.
I remember looking through your profile. Let's see. Yeah, you had him on.
It
here.
was 20. When did we do that? 2020?
Oh, what are you reliable now?
2021. 2021, I think. But it's in that time frame.
Here it is.
There.
Okay, let's look at these here.
Yeah, especially the cortisone, the cortisol, but also the other hormones too.
Let's see if we see any issues. Pregnenolone, progesterone, low end range, low luteal range. Yeah. Okay, so yeah, I mean a lot of your levels are at the low end of the range.
Yeah.
So hormones can definitely have an impact on your brain inflammation and your brain recovery and everything.
And I supplemented with DHEA, 25 milligrams for a while, but I felt no different.
Let me put it this way: you start taking hormones, you lose your FSH feedback loop.
Mm-hmm.
If you take estradiol, your ovarian fertility feedback loop is now suppressed.
Mm-hmm.
You already have concerns about that feedback loop.
Okay.
You really got to if you're going to go on hormones, your window of time for pregnancy, your actual physiological feedback loop may be impacted.
Okay.
I don't know to what degree or how much.
Okay.
If you're pregnancy is not an issue right now, we decided it's not right for us. You definitely could be a candidate to get your hormone levels updated,
Mm-hmm.
and then see if you need to go on replacement. That might help you a lot with your brain recovery and inflammation.
Okay.
It just depends on if you want to go in that direction right now.
Okay. I did take progesterone for a while, but I felt no different. Nothing.
Oh yeah, listen, none of these things are going to make you feel different dramatically. These are all going to just be factors that help you recover.
Oh, okay. You're saying it could be contributing to helping the
Yeah, I mean, if
brain
you're
inflammation.
even if your hormone levels were, let's say, low and you took it, you probably won't notice I'm back.
No,
but
yeah. Exactly.
in the big picture of things, it will help because lots of research clearly shows they have an impact on
Yeah. Okay.
brain synaptic activity and
I think
clearance,
this was in your book.
and everyone's going to be a little bit different than others.
Okay.
So it's definitely
That's
something
okay.
to pay attention to.
Okay.
I don't know if you want to jump into it right now.
Yeah.
If you want to jump into it right now, you can. It's just realize that
Yeah.
you're also starting to show menopause.
Oh, so do you think so? Maybe.
Maybe.
Okay.
But your anti-malarial hormone being off, and your follicles being low,
Okay. The doctor that gave me the progesterone said I should sleep better.
yeah, progesterone won't be that big of a deal.
Really?
That will be the estrogens because that's what's going to throw off your FSH feedback.
Oh, okay. The cortisone to cortisol,
Yeah, I wouldn't worry about that.
is that thyroid?
It's nothing. It's just what
It's
Dutch has made up. It's a Dutch made up thing.
so I have really low.
Don't worry about it.
Okay. Okay, how many times a week? Does it matter working out? I used to do 3.
And by the way, when they say cortisone being low, it's not like it's inaccurate or anything. It's just if you go on and do an entire literature review, everything published in medicine, you're not going to find anything on it. It's just that the lab is measured and they have a ratio they put it on. You can make some clinical significance for it for some patterns.
My
But your
nutritionist was
cortisol
saying
just-
I don't have any. I would feel more energetic if I had a better conversion from cortisone to cortisol, and she was saying that.
Yeah, I mean theoretically, because cortisol is much more powerful. What you're seeing in urine doesn't reflect what's happening necessarily in the system.
Okay.
Because your cortisol conversion taking place in your renal tubules and your liver pathways is completely different than what's happening in your blood. That's every type of hormone testing has benefits, right? As far as urine testing goes, Dutch testing is a great lab. So the issue isn't with the lab. The issue is with it's a urine test, and urine tests have some limitations.
Okay.
So it wouldn't be as reliable as some of these conversion ratios and all
So
that.
you're saying the levels in here may not be.
It's not the focus. Don't. We're not playing. We don't want to keep playing greatest hits.
So I take the HCl and enzymes, and I've been seeing a lot of undigested fiber as well.
You probably need to take more enzymes.
Take more enzyme. Do you have I know you don't like recommending types, but is there a good type that you use
Whatever you can get in
often?
Sweden, it's fun.
It doesn't really matter.
I mean, like the energy and the demand of trying to get you to cross the border and do it all here, like it won't be that much of a difference.
Okay.
Don't waste your time. Let's focus on.
Yeah. Okay. So you've been focusing in so many different places. Yeah, I was curious about. Is there some reason why the fruit is showing up more? Like fruit is reactive, but the vegetables are not. Is there some kind of reasoning behind that? I thought that was weird because I don't eat tons of fruit.
You know, with the food sensitivity test?
Mm-hmm.
Well, the food sensitivity test, you have to remember, is just measuring proteins. And the only difference between fruit and proteins in fruits and vegetables is only sugar. I don't know of any difference
Okay.
because of that.
I was surprised that you didn't want to look into the gluten testing for Cyrex or Array 3.
Yeah, we can add that on.
Is that something you're curious about at all, like celiac, or does that impact what we're doing?
Well, when I read you're already gluten, dairy free.
Yeah, maybe like to get the trace amounts of gluten out. Maybe it might be nice to know. But
Sure. So there's some
yeah.
So like the advantage of doing like Cyrex Array 3 would be more they check for gluten sensitivity and reactions is if you're still getting trace amounts without you knowing,
Mm-hmm.
that will confirm it. Okay.
Mm-hmm.
In any case, you still have to be strict gluten free, especially right now, because it's such an inflammatory protein trigger.
Okay.
And then secondly, they do test markers that are more associated with celiac, like transglutaminase 2.
Yeah.
And that's that could help to see if there's a greater severity of responses to gluten. So it's a test you can add in if you want to.
Mm-hmm.
I think it's like $200 or $300, something like that.
And then alongside that, the cross-reactivity one.
The
I was
food
just
protein-
curious about the food sensitivity because the ones that showed up here kind of surprised me. And so if I'm eating stuff that I don't realize,
Yeah, we could add the food proteins as well if you like.
because there's a big,
That's Array 10.
maybe we talk about that in the cross-reactivity one. Like, do you suggest any one of them or?
So this is giving you a clinical perspective, okay? We're already putting you on a autoimmune paleo FODMAP diet.
Mm-hmm.
And we still want you to eat, okay? The times we really like jump into food sensitivity is like we don't know what you're eating.
Yeah.
We don't know what's going to be the main thing. Now, obviously, if there's a food protein that's like off the charts, it's a trigger.
Mm-hmm.
It'd be nice to know. So there's some
Yeah.
benefits.
Okay.
It's a personal call if you want. Like I'm on the board as a clinician. If you want to do it, it's just if you want to do it, it's just the cost.
I just wanted to mention to it, see where you
Do you
said,
want? Do you
'cause I'm
want
not
to?
sure.
What do you want to do?
I would like to have the information, but I would also like to cap the
Cost.
spending. Yeah.
So it's up to you.
And maybe do it at some point. I don't know. I'll think
Well,
about
that's,
it.
I mean, maybe
Because I
it
have been
makes
eating
sense.
so restricted
Yeah.
anyways that I don't know.
I'll tell you a good time to do it. First of all, if you have any reaction to foods, just avoid it. And you had a recent food sensitivity test already. Okay, so you have some general ideas.
Yeah.
And it's definitely showing lectin patterns, right? And some
Which I
random
was,
foods.
yeah,
Okay.
eating, so I stopped.
So
Lectins.
once you're like out of being so restricted with food and you want to start introducing foods back in, then a good way is to introduce foods back in. And then like 2 months after you started doing that, your antibodies peak
Yes.
and then retest.
And the board they already drew is.
Or you can do it right now and just get an idea what you are reacting to. Because remember, anything that triggers your neuroinflammation will slow you down.
So eat a variety of stuff at some point, and
At some point,
2
yeah.
months later. do the
But
blood
they both
draw.
have benefits. We can do it right now to see what could be triggering neuroinflammation that you may
Yeah.
not have identified.
Okay.
Or you can wait later.
Let me think about that. That's one of the things that we should note and make.
Once you've had your blood drawn, we can add in tests
That's-
for a period of time. I'm not sure the exact times, but
up
Susan.
to 90 days.
So
They
Susan said-
freeze it on day 21, so
Okay.
it's
So,
really
so
easy.
for the next 3 months, if you go, hey, I really want that test added in, they have your sample frozen.
I also found a nutritionist that follows you in Sweden, and so she's
Oh, nice.
willing to pass along. She's willing to order labs for me, even though she's not
Oh,
really my practitioner.
You can do Cyrex in Sweden?
Yeah,
Okay, great.
because until I'm working with you.
So in the next
she'll
3
know.
months, you can add in any of the panels you want.
Before that's that's a nice feature. Okay. Is sunflower lecithin?
That was I mentioned a couple of things. Like we could measure things like blood-brain barrier protein.
Which we did.
You did blood-brain protein and rate 5. Yeah.
No.
5 and 20.
Yeah, we did 5 blood-brain barrier and intestinal permeability. That's what that pulled this first time.
3, 5, and 3, 5.
I don't remember the number.
So leaky gut, rate 5 and 20. Okay.
Okay. With sunflower seeds, is that sunflower oil and lecithin as well? If I'm sensitive to sunflower seeds, do I need to avoid sunflower oil and lecithin?
Not necessarily.
Okay.
Let's see how you feel. But they're different proteins.
And the things that showed up low, the doctor who came in today,
You mean
he was
food-
saying if it showed up low, you can eat it frequently. If it's
the
not,
food sensitivity panel?
yeah. Yeah. But I wouldn't.
Just stick to the autoimmune paleo right now.
Yeah. Okay.
That because they're going into the realm of a rotation diet and other things. It's a different model. Not to say it's wrong. It's just a different model with a different application. Right now, we're just trying to make sure you don't have any being aggressive with triggers altogether.
Okay. Then the only thing, so Dave Asprey's book, The Fastest Way, he's talking about for women and cycling in and out of ketosis because of like damaging issues to reproductive hormones, causing.
Never heard of it.
Yeah. Okay.
I wouldn't be worried about that.
Yeah. Okay.
I mean, this is the. I won't say anything. Go ahead.
Okay. Soy. Just reading. Lectins out. Alcohol, I assume. Out.
What does alcohol mean to you?
Oh gosh, it's not. Nothing is worth my health.
In general.
But it.
What happens if you have a drink?
I feel good. It used to mess with my sleep, but it's not so much anymore.
Until the next day.
Well, while you're in ketosis,
That's what I'm asking.
you can do. Okay, well, let me put it this way: alcohol is not good.
Yeah.
Alcohol is especially not good with prime glial cells.
Okay.
Okay.
Just be straight. That's
Yeah. You have to also not be totally depressed and live and function and have some breaks. Okay.
Yeah.
If you want, but if you drink alcohol every day, it's just gonna totally get in the way.
Right. I don't want it.
If you have a special occasion, you want to have a drink while you're doing all this, okay? Have something like vodka or, a very clean liquor, very
Not
clean
whiskey.
distilled liquor. Yeah, you can probably do whiskey. It's distilled.
So
really
you're
well.
just saying not a sugary mixed up
Yeah.
drink. Yeah.
So they're the low sugar alcohols. So then, like, it won't. That made as to get back into ketosis would be much easier than if you had wine.
Okay.
But if you have wine too, that's fine too. And then also here's the other thing too. You could break out of ketosis at any time. Like if you're like need a break, they break out and then go back in. Like because you're gonna do this long term.
Yeah.
So if you're like, hey, I'm going to a special dinner, special occasion.
Yeah, my birthday next week.
Okay, whatever it is.
Yeah.
And say I want to be out of ketosis, then break out of ketosis, and then go back in.
Okay.
So it's not like, oh my God, you totally blew it.
Okay, that's a little bit.
Okay.
Well, yeah.
The most important thing is just communicate. So it's actually not a bad idea to do that every now and then, but we want long-term sustained ketosis to see if your brain has capacity to change. If you're breaking it all the time.
No, I'm not. I don't have a tendency to do that, but I do have a tendency to drive things too hard and then just be done and tired of doing everything. But that will help. I'm curious about. So I got into that.
So I'm going to ask you something. I'm noticing your speech is slurring now. Is that normal?
I feel tired.
Okay.
I don't know. It's not. Is it normal? I don't know.
Have you noticed it?
I mean,
Have you noticed it?
I honestly am. I probably just I'm so around it so much, so maybe I don't even I'm not even paying attention. So
Your speech is getting slurry because you're getting tired. Okay, it's okay. That's cerebellum. So, you want a tissue? You're okay?
Love bringing people when you get upset around and they're like...
No, I say, and the reason I'm saying this to you is we definitely want to look at observable signs of fatigue. Okay?
Yeah.
I mean, speech is your motor speech area and your cerebellum kind of working together, both of which you have symptoms of. Okay?
Mm-hmm.
So, we want to see over time, like, hey, that's not happening as much, or if you can start paying attention to it.
Yeah, I will definitely. Okay.
You okay?
Yeah. Yeah, on one hand, this is very interesting, but I think that's, like, terrifying.
You shouldn't be terrified. You should be really optimized and
I am
and
too.
excited. Yeah. Don't
But
be
this jumps in, like,
absolutely don't be terrified.
it's been a lot.
Yeah.
You know?
I'm gonna be a little cocky and say this is actually day one.
I want to politely...
I just don't think you were diagnosed properly this whole time.
Yeah.
I know. Yeah.
Yeah.
I know.
Yeah, and that's just some of those things didn't have some benefits with you and everything, but it's like
That was a total joke. I hope.
yeah. And you just be like, listen, you're I think this is the right diagnosis.
It is.
And I think,
I know. Yeah.
and I think you haven't done anything yet, so you have so much potential. And you've already shown a lot of potential because you had a significant response when you went to a ketosis state and to that. And you were only for a short period of time. Now imagine you do that sustained for a long period of time. Start doing autophagy. You know, there's also so many different ways we can treat your brain outside of just this, and so many things we can do. Like this is just starting. There's lots of applications. So you should be don't be terrified.
Well, I put a lot of stock in, like, who I am is my ability to be able to use this stuff, and without it, that's scary.
I understand.
I can't even, how can I keep a straight face?
You want a break? You want to take a break?
No, I'm good.
Okay.
Coffee enemas. So I really had been, like, I feel so much better when I do those.
Keep doing it.
Mentally, but physically. But recently I noticed that they used to come back out really easily, and somewhere they just kind of stopped coming back out. And then I just have, like, a stomach full of water. Is there any ideas?
You mean your
on what
coffee,
might be
your
going on
contents?
there?
Your contents, you mean?
Yeah, the enema content. Everything.
You might need to make your caffeine concentration higher.
Just keep going up.
Yeah, because basically what you're doing is you're doing coffee enema. Is the caffeine stimulates receptors? They're called nicotinic acetylcholine receptors in the gut. They stimulate them, and that causes contractibility.
Yeah.
If you use them, if you do it regularly over a period of time,
It kind of dropped off a cliff, though. It was pretty abrupt.
those receptors get sensitized.
Okay, I'll try more.
So then you just
Caffeine.
you don't have to try. Yeah, just make the concentration of caffeine stronger.
Okay. It happened really fast, and then it just stayed like that, so I was wondering.
Just experiment. I would. The first thing I do is just increase your concentration of caffeine.
Okay.
So.
Red light, infrared light for brain.
It's working for you. Keep going.
Like one that's more powerful for going through your skull.
I don't know.
Yeah. Okay. These are all very just huge variety. Don't remember that. Yeah, this. I don't know what you're gonna say to this, but. And this is probably something we address as we go forward, but balancing work and stress. Like, at some point, I want to go back to work.
Yep.
And the type of work, I think I'm a person that gets stressed out easy.
Yep.
And so, like, your guidance on how to manage the impact and be attentive with that, or, like, if I need to make sure that I have just something that is low stress ongoing, like, that's something on my mind.
Yep. So this is how it typically works. It typically works as you get better. You don't go from black and white. Okay.
Yeah.
The first things that actually change is your endurance.
Good.
Okay, so
Yeah.
let's say right now if you did 2 hours of a task,
Yeah.
and I don't know what the number is for you, but let's say whatever it's 2 hours.
It changes all the time.
Okay, and they could change again with all these different
Yeah.
variables, right? But let's say it's 2 hours. As you start to get better, then it can go to 4 hours, and then go to 6 hours, and then if you haven't had sleep, maybe it goes back to 4 hours. So what you're gonna notice is you won't go from like your deficit of symptoms now or symptoms now to like overnight went better.
Good.
It'll be a slowly gradual improvements in your cognitive endurance,
Mm-hmm.
and then over time you'll have to judge how much you can do,
Yeah.
right? But you'll have to experiment with what's going to happen.
Mm.
It's going to be based on how you respond.
Mm-hmm.
So you definitely want to put yourself in a position where you can do work where you can tap out,
That's what I worry about.
and then focus back on.
Yeah. Okay. But like stress levels, that's pretty important for us right now.
Yeah.
To avoid having extra stress.
Yep.
Okay. Yeah. Thyroglobulin was high. I'm curious what that was on the blood test. Is that significant for anything that we're doing?
Thyroglobulin.
Because that's one that I thought was the antibodies, but I looked back and I was like, that's not.
That's probably why they do the biopsy. Because thyroglobulin can go up with tissue growth.
Oh.
So it's like a marker for cancer. But if you had the biopsy afterwards, did you have a biopsy afterwards?
No, that was a recent one.
Okay, let's check it again.
And yeah, like the low white blood cells. There was IgG subclass 4 was very low.
Yeah.
Okay. And then based on, I want to know like of your classes, like what you recommend for me to continue learning more after, if there's anything obvious, like practitioner versus layman course.
Oh, which
or
class have you
things like
taken?
that. I took the Hashimoto's thinking I for sure had Hashimoto's.
Okay.
And then I get to the end and I'm like, maybe I don't. But,
There's a course I did on neuroinflammation.
okay.
That would be a good one.
Is that the Save Your Brain or is the neuroinflammation, is it gut health?
It's like the one I did for neuroinflammation is for the Crosby Institute. It is like it's for practitioners, but I don't think you'd have any problem with it.
That's what Susan said. Okay.
Yeah.
Okay. I think I don't have any more. Let me just check my phone. 'Cause we covered a lot of this stuff and a lot of it doesn't feel relevant anymore. So.
Great. Let's give you a little break.